Okay,
Well,
how's Florida?
It's nice. I like it. We're having
Good.
fun.
Orlando?
Keeping it safe.
Okay. Orlando?
Orlando, yeah. But we're
You
not
guys
doing
do
any
that.
theme parks or anything like that.
Are you guys at that jungle hotel where the animals are? Huh?
Okay.
No,
What's that?
no,
Animals are.
just a resort.
Nope, that's it. I think.
Okay.
No,
Nice.
no, just a resort.
Did you take all the kids or just you and Jeff?
No, Jeff's not here. Jeff's working.
Okay.
Oh,
So
wow.
it's just me and the kids.
Hey, these are real delayed, Ryan. The speaker, like Monty says, so.
They're fine. We're getting feedback.
These are real delayed, Ryan.
And I'm hearing
I think
something,
you've
yeah,
got to go on
in the
mute.
back.
You gotta go on mute.
I am too. I can hear something too. I don't know what it is.
Yeah, hold on a second. It's the YouTube screen. Okay,
Oh,
that
that's
should
better.
solve that.
Can you hear me, Gina?
Yeah, I can hear you, and that
Okay,
that
that was
sing-songy thing is gone.
Yeah, that was the YouTube stream. We have two things going on, so, yeah. It's
So
okay.
Okay, I'm trying to put myself on mute, but I don't, it's not working.
all the side conversations, everything right now is being broadcast live.
Understood. Can you put us on mute there for a few
Yep,
minutes?
we're gonna go mute.
Okay.
I can see everybody, but I can't see me. I don't know why. Lisa Ajay's there. Kevin's there. Ryan's there. Gina's there. Ken's not there yet, or Terry.
Until it starts if you want, and then otherwise everybody, there you go. There you go. Otherwise everybody, can- hey, Lisa.
Okay, so we're gonna go ahead and mute for just a couple more minutes.
A group mute.
I don't know why my camera's not on.
They can hear you, but you can't.
They can't see me, but they can hear me.
Can you hear me?
Ken, I can hear you just fine.
Okay, good. I got it.
Amy's here. Amy's here. I've been in this boardroom in a while. Been a month or so.
Yeah,
Yeah, I haven't been in here.
it's beautiful. You
Yeah.
guys did an awesome.
Isn't this thing great? Yeah.
I'm looking to see waiting to see the final thing there because I saw it, while I was going and stuff. So it's got to be getting real close.
Oh, it's just punch list. Yeah. It's
Is he going to make you stay over here in the old office? Or are you going to let you move over?
I'm gonna be in my office over there.
Oh, see, that's what you get for being in the back. Got to make him remodel it for you.
Nah, I don't need anything fancy.
We'd get it for us. Yes. That's all right.
We're currently live now.
I think I might have come out of the screen all of a sudden. Oh, just because you moved him over to the right. Yeah.
Oh,
I think people.
I'll go over to and read that top statement.
Can you guys hear me now?
I don't. Yes.
Yeah. Hey, Charlene.
Okay, I'm good.
Yeah, we can
Lisa's
see you.
still muted. Okay. Yeah, I forgot to do the thing up at the top, but now I did it. And now you can see me.
So do we have Terry?
Terry's the only one we're missing, I think.
I think I'm on.
Oh,
Yeah.
Okay.
all right, great.
Yeah,
Oh, she's on the second. You're on the second page, Terry. We got you, I think.
Terry.
Oh,
Anderson.
yeah.
No,
Terry, I hear you.
You do hear me?
yes.
I do. Yes.
Okay, so we have Terry, we have Charlene, we have Monty, adjacent to me. We have
We just don't see your face. That's
Ken Burkus.
He's here.
Yes, I see him.
Oh, I see Ken. And I see.
Hello.
Grant Herndon's going to be just a few minutes. So that might be the last.
Is Matt on the?
Yes, he is.
Constantine?
Yes.
Yes, I'm here.
Oh, there's Matt. Okay, great, great. I wait 1 minute just to see if Grant Herndon can pop on here.
Attaboy, Monty.
It wasn't me.
Oh,
Hello, Caleb. He heard me.
I hear the kids again.
There's Grant. I think we're ready.
Okay, good.
Is he here?
So, go ahead, Mom. Ready? Yeah.
This calls the Beardsley Board of Trustee meeting for July 17th, 2020 special board meeting. Time is 4:01 and we will have a roll call. Charlene is present, Ken is present, Gina is present, Terry is present, and I am here. Flag salute. Paul, would you lead us, please?
Oh, gee, seriously.
Okay, salute, pledge. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you, Paul.
Public comments, do we have any?
Yeah, I'd like to, out of respect for his time, I'd like to have Matt Constantine start us off today with some comments. If you don't know Matt, you've probably seen him on TV. He's the Director of Public Health Services, and I am enormously grateful that he would come and join our Zoom. His time is stretched, obviously, in these days, and it's really, really neat that he would do this for us at 4 o'clock. Matt's going to update us kind of the latest health trends, I think, in Kern County, and maybe talk just a second or two about what just broke, and maybe an hour ago or 2 hours ago, the governor came out and laid down some new protocol and rules. So Matt, would you go ahead and take it from there?
Well, of course. Thank you for allowing me to descend into your meeting. And I'm grateful that you're so interested in tracking this so closely. Just for an overview, in Kern County, we are continuing to see increasing number of average new cases a day. So this is not something that's gone away or going away soon. We have some sustained growth in the cases, which has been expected. The state has given us a model to use, and that model, by inputting local Kern County data into it, shows that we will continue to see cases rise through the summer months. And the model shows that we peak in February with the number of cases, and we slowly then start to reduce cases, the average number of new cases. And that doesn't really subside significantly until late summer of 2021. This model that the state gave us several months ago, which we all thought was unrealistic, surprisingly, when we find ourselves in the middle of July, is tracking fairly closely to what the state has projected. In Kern County, we are concerned with our ability for our healthcare system to provide resources to those that are most in need. In Kern, though, we're a little different. In many places, it's hospital beds that drive some of the local concern. In Kern, that's not the case. In Kern, it's ICU beds that is concerning us. So just to give you some perspective, the model shows that by the end of July, we will likely run out of available ICU beds. And again, we thought that was a little shocking when we were doing this in May, but sure enough, those ICU beds are slowly starting to be used. The model shows that we actually exceed our ICU capacity on July 28th in a couple of weeks. Knowing that, we asked the hospital, our 10 acute care hospitals, to get together and find ways to expand their ICU capacity. And they did just that. They all pulled together. They found every bed, every janitor's closet, every hallway to fill up. And they have told us now that they could take a surge of 294 ICU patients, which is significantly higher than what they usually maintain. The problem is we even exceed that. The model shows on November 13th, we exceed even their surge capacity. And we peak on February 5th at a demand of 436 beds. So we're still, even under this surge capacity, 150 or so short. This is the model, this is the concept of flattening the curve that everybody talks about. We can treat a lot of people, we just can't treat a lot of people at once. And that is our worst case scenario, that if we needed somebody that needed ICU care or a ventilator, according to the model, towards November, we may be out. Now, there are some resources available if that happens. There's mutual aid and abilities elsewhere, but likely other Central Valley counties and the state would be facing similar shortages. It's important to note it's a model. And today I have upwards of 800 hospital beds available. I have about 70 ICU beds available. Our capacity remains good. We have recognized, though, that staffing those beds is now another issue. So the county is actually looking at trying to expand nursing capabilities in those hospitals. And so the point of that discussion is COVID-19 is still here. Those cases are continuing to rise. We have done a lot of work to flatten the curve. We have a lot more work to go. Just this month alone, the hospitals have become very busy. Our ambulance providers, for us in Bakersfield, that's Hall Ambulance, is very busy. They're struggling to keep up. The system is under a lot of strain. So we're concerned. We're doing everything possible that we can. We continue to reemphasize the need for people to take personal responsibility, to heed the governor's orders. I know it's difficult to wear a face mask when you're out on the hot summer days in Bakersfield, but that and distancing really makes a significant difference. Now, it's interesting too, we have had in the last several weeks a real demand for testing. People have responded, and testing is a cornerstone to controlling this virus. If I can test people and I can isolate those that are contagious, and I can trace those that have been exposed, I can limit the spread of the disease. The public responded, and in the last several weeks, we have seen about a fourfold increase in demand at our local testing centers. We have 10 dedicated testing sites that are free. You don't have to have symptoms. You can go as often as you like. And they have been inundated. And what is happening then is the labs statewide and nationwide have delays. They're running out of reagents, they're running out of testing supplies. And so there's been, unfortunately, a delay in getting lab reports back. So what's happened in the last week is public health now is receiving significant numbers of lab reports. And you will see probably tomorrow a several-fold increase in the number of positive cases that we're reporting locally. I think today we had about 150-ish. It wouldn't surprise me if we see numbers 4 or 5 times that amount tomorrow and going forward. So that matters to us locally and to you as elected school boards and educators, because based on our statistics, the state has created what they call a monitoring program. We affectionately call it a watch list. And for counties that exceed some of their state's metrics, which are about 80% of the counties in California, they have these further restrictions. So we've seen a week ago where the governor asked that bars and restaurants curtail their operations. And then most recently on Monday, the governor announced some additional sectors that needed to close down. Now those only applied in counties that were failing those monitoring metrics. And although Kern failed it for the last 21 days in a row, the last few days we've been in compliance. we've met the metrics, which is good news. Our concern is that that doesn't necessarily, we don't think we'll sustain that, and we likely think we will exceed those metrics in the coming days. Now, as Paul mentioned, this matters even more so now because today the governor came out with a revised school guidance document. And he has indicated in this document, and we haven't read it all yet because it just came out, that if you're on the state's monitoring program, meaning you're failing their metrics, that schools are only allowed to operate under a distance learning model. For counties that are achieving the state metrics for 14 days in a row, are allowed to reopen as long as you follow their guidance document. It's about a 13-page guidance document that Paul's familiar with that requires face coverings and distancing and quite a bit of changes operationally. But this new document that just came out is going to dramatically impact Kern. So as it stands today, we are not on the list, but we are also we haven't been off the list for 14 days. So we're sort of in this middle zone currently. Even if we're lucky enough for the next couple days to meet the metrics, it seems likely in the near future we will not. And I would expect that we would not for some period of time. So as elected school board members, you have a difficult position in front of you on making some decisions based on incomplete data. I would anticipate that we will fail those metrics and that the state will mandate we use a distance learning model for the near future. But we don't have the data yet, and we watch it every day. That new document that came out today has all kinds of specific requirements that we'll need to review. There's an opportunity for school districts, for elementary school districts, to ask for a waiver. There's a whole process. You have to get unions involved and parents and community organizations involved. There's testing requirements now for teachers and staff that they have to have routine testing done. There's limitations on school-based sporting events. So it's pretty extensive. So Paul, help me understand if I've missed anything or if I should focus on anything else or if you have any questions.
No, Matt, that's great. Hey, tell me though, is the California Department of Health, are they putting out new guidance Monday or Tuesday, or did that come out today as well? Or
it just came out today. Yes, sir. About 1 o'clock or 2 o'clock it came out.
Okay, great.
I will send it to you if you don't have it.
Yeah, no, thank you very much. So does anybody have any questions of Matt? It's a rare opportunity to talk to the top health officials in the state here. So if anybody has any specific questions for him, this would be the time to unmute and go ahead and ask. That's okay, Matt?
Of course.
I have a question.
Okay, Charlene.
Did I understand you correctly that we are supposed to peak in July of next year?
So the model that we have that the state gave us shows that we will peak in February of 2021.
Okay, February, but
Yes,
that's
ma'am.
next year. Okay,
Yes, ma'am.
thank you. I thank you for clarifying that.
Matt, I've got a question. So this has all just happened, right? So I'm kind of take this in, of course, like everybody else, but if you get off the list, you've got to have 14 consecutive days off of it, right? Is that correct?
Yes, sir.
Yeah. You can fall back on it, get off it, and fall back on it, and get back on it.
Yeah.
Right?
The way the state is proposing in their new guidance document says that if the county meets the metrics for 14 days and then if a school board decides to open in-person learning, they may, if the county then subsequently falls, fails the metrics, that schools are allowed to remain open. They just have to make sure that they have a lot of protocols in place. So they're not asking you to close and open and close and open.
Okay.
So once you can open, you can stay open at that point. So if we have that 14-day window that allows us to allow schools to open, that might be something for you guys to consider. But that's certainly hard to manage such a large organization on such a moment's notice.
Yeah, it is. Yeah, I didn't know that though. So appreciate that.
Yes, sir.
I have a question.
Yeah, sorry. Go ahead.
So currently, right now, Kern County is not on the watch list.
Correct.
And you're anticipating that in the next few days, we could go back on.
Yes, sir.
Okay. So then let's say the middle of next week, they take us off again. We've got to have 14 days off the list before we could have the kids go to school.
Yes, sir.
If we were open. Okay.
And Matt, just so I know that, again, I know this is brand new here, but if we got a 14-day run where we were off the list, that would be, and we elected to in some form have some students on site, it wouldn't be a seesaw thing back and forth. We're good. It's a green light after 14 to stay with that model.
That's my understanding. This is 2 hours into this document, but that's my understanding. Yes.
Okay. Yeah. I was confused on that on the call. So yeah, that's, I know this is all brand new to you too. So.
Yes, sir.
And I have a follow-up. I have a follow-up to that. So let's say that we're off for 14 days. We begin school. We're in some, maybe a hybrid or what have you. And then all of a sudden the county goes back on the list. And we have to have protocols in place if we decide to stay open. Is there something where the county or the state would then come in later and say, it's too dangerous for you guys to stay in your hybrid model?
So there is some general language that if things got horribly bad or there were significant numbers of cases or there was an outbreak, that there is some ability where we would consult with you and try to figure out how best to control it. So I don't have specific language, but I think that always exists. Yes, sir.
Okay.
And Matt, I did see, again, just really fresh here, but I did see that I think if an individual school has 5% of the students identified, I believe that was the number, with COVID, that school would close, but the district itself would not have to close unless 25% of the schools in the district had that situation.
Yeah, they have established triggers for when they want you to take actions. And, you know, we've been working through that now. Paul's been a participant in some of these discussions about measures to not only protect the kids initially, but then also what we do once there is a positive. And Kern County Superintendent of Schools have kind of coordinated some documents on that. We want to have that ironed out now in advance so that when this happens, we're ready. But Paul, you're right. They have actually dictated when you hit certain thresholds, they want you to take certain actions.
Yeah, and Matt, tonight we're reviewing our detailed plan for protocol for responding.
Oh, okay. Great.
Yes, timely there.
Because you will have positives. You're going to have positive kids. You're going to have positive staff. It's a guarantee. And planning for that now helps. Taking, you know, the important thing to consider is that 13-page document, Paul, that came out, you know, a couple months ago on school guidance is crucial. And it's really important that you follow that carefully. And I know it's a guidance document, but it is based on science. So that if you have the teachers all wearing face masks, not face coverings, but face masks, and you have the children wearing face coverings, which I know is hard, and you're maximizing that distance that the kids are between each other and with the teacher, and all of your staff always wear face masks, and that means all the time. So when they go into the break room, you really shouldn't be eating with anybody because that exposes everybody else. But if you're constantly doing that and strongly adhering to it, if you have a positive employee and they're masked the whole time, there's little action that needs to be taken. But if we find out, yeah, you know what, they ate together, or they kind of had it on some of the time, or they wore it below their nose, then anybody that's within 6 feet for greater than 15 minutes will be asked to self-isolate at home. And that can just devastate a school. You lose some teachers and some administrative folks. It is just impossible to continue. So we learned this, I'll be honest, even at public health months ago. We weren't as strong as we should have been, and we sent a ton of people home for 14 days. We learned the hard way. So follow those guidance documents carefully. It really helps.
I have a follow-up on that as well. So for example, if we were open and we had a staff member or we had several students that did test positive, barring any kind of severe symptoms, they would have to be at home isolated for 14 days, correct?
Yes, sir. Yes, sir.
And if they are at the end of that 14 days, is there a protocol that says this is what you have to meet before you can come back?
So there's two approaches. If you're a positive case, in order for you to return, you have to meet the CDC's definition to be released. And it's everybody's different. So you have to be, I think, at least 10 days from symptom onset. You have to have resolving symptoms, and you also have to be fever-free for 3 days without medication. Some people do that within 14 days. Some take 2 months or longer. Now, if you're a contact to a positive case, we send you home for that incubation period, and we just tell you to stay home and look for symptoms. After 14 days, then you can come back. The problem with that is when you go home as either a case or as a contact, and you think, oh, great, I got 2 weeks off. That means that you're in a separate room. You don't see your family. You don't see dinner together. You don't share a bathroom together. Somebody shoves food under your door. You don't go out to the store. You don't go to the mailbox. I mean, it sounds fun at first, like, oh, I'm going to watch TV for all day. You have no contact because you don't want to expose anybody else in your family. Or if you get re-exposed, your 14 days starts over again. It's a pain.
Don't you have to test also? Even if you're
So
just
on a contact, we wouldn't recommend testing. It's not needed. We're going to just look for symptoms. You can if you choose, but it will not shorten your isolation period.
Wow.
I had a question. Kevin Williams here. Hey, a minute ago or a while ago, you corrected yourself. You were saying staff members need to wear face masks, and you originally said face coverings. Is there a difference? What is the difference?
Yes, thank you for reminding me to point that out. So a face mask would be what we consider a surgical mask. It's the medical grade mask that is used traditionally during surgeries. It has been reviewed and approved based on the material used. A face covering, and these are state defined terms, can be a homemade cloth covering that you put over your face. There's no sort of standard about how thick is the cloth or how it's made or manufactured, but surgical masks are designed to keep respiratory secretions from getting into somebody else. And remember, it's source control. So when I wear it and I'm next to you, Kevin, I'm protecting you from my diseased self. It's not, people think it's the other way around. Well, it might provide a little protection, but it's source control. So as long as everybody's wearing it, we're good.
What about face shields?
So face shields should be the same analogy as goggles or glasses. It helps protect your eyes, but it does not help prevent respiratory secretions from getting into you because it doesn't seal around your face, right? It just kind of covers the front of your face. So you can consider those as helping protect your eyes, but that's it. You would still need a face mask.
Okay, so the protocol is a face mask, period.
Yeah,
Right.
the guidance document from the state says that staff should have face masks. Yes.
Okay, thank you.
There was some discussion, and Paul might have heard this, but about the state trying to help schools obtain personal protective equipment, PPE. There was not much discussion about it, but it did come up knowing that schools needed help in obtaining PPE.
Yeah, that's for sure. Dave, did you, I thought a few minutes ago you wanted to ask a question, Dave Hilton.
Yeah, if you don't mind. Matt, you were talking about the state's projections earlier that they're kind of holding true right now. If those continue to do so, do you actually see Kern County coming off the watch list before the end of the 2021 school year?
So you can't hold me to this, but I don't think the outlook is good. You know, from the onset of the creation of the monitoring list, we were on it from day one, and we did great. Somehow the stars aligned, and it was shocking to us, but we've met the metrics. I think partially because there was the labs that were delaying on testing, and we're now getting those. So I'm not sure that was a great true measure, and I'm worried that this surge of testing results that we're getting. I mean, I've had to staff up threefold in some of my areas just to address this surge. So I'm worried that that's going to affect those metrics.
Matt, this is a hardball question. This is a tough question, so I don't expect take the answer to the bank. But we're hearing about kids, right, not contracting this to the same degree or being asymptomatic. We don't know they have them. The jury is still out on them being vectors for this or spreaders of it to others. I know that. Anyway, I'll let you answer.
Yeah, you're right. The jury is still out. We're still learning. We believe children may not be as susceptible or may not suffer symptoms at the same rate that adults do. It's a little hard to tell. It's a little early. We're not sure if they have some different immunity to it, but we do hear stories on both sides. So I'm cautious to say too much. But if you look at our dashboard, most of the positive cases are those that are adults, older. I mean, I think we put it into 17 to 49, but yes.
Thank you. Yeah, I know that's not known there, but I just appreciate you attempting to answer that. Anybody else before we let Matt go off probably to another meeting here on Friday night?
Just one more, Mr. Constantine. My name's Grant Herndon with Kern County Superintendent of Schools.
Hi, Grant.
Hi. And, Kern County being as large as the state of Massachusetts, it just, it seems kind of challenging to have us all under one metric when Ridgecrest and Taft may be very different. Did I read something? I've just read these very quickly like you have about an ability to get a waiver in certain circumstances? Or?
So my only understanding of the waiver was that if we were failing the metrics and that in-person learning was not allowed, that an elementary school could ask for a waiver going through the local health department and working with California Department of Public Health. But and again, I haven't read it extensively. It was just to allow consideration for elementary schools, but not a sort of geographic waiver. Kern is so large, we're kind of unique, and Grant's comments are well received. We have such distinct geographic regions, and there's been a lot of interest in the desert region to sort of separate from the rest of us since we're so contaminated in comparison to them. I don't think that's going to be well received. The governor has not allowed other counties to do that. They like to deal with county entities because of that structure. So to my knowledge, no, sir, not yet.
but it could be possible on a school, elementary school district basis.
Yes, the part of that is they require the school to, I think, gain consensus from unions, parents, they said community groups, and then the health department, and then some pretty extensive consultation with the California Department of Public Health. They certainly didn't make it sound like it was going to be easy or something that was just going to be stamped. So that would be a challenge, I think. But yes, it's listed.
Okay, thank you. Appreciate it.
So.
Ryan, did we have any questions in from the other group, the YouTube group, for Matt that you can see? Or
We're only taking questions via email.
okay, okay, that's right. Okay, so if there's nothing further for Matt, we'll thank and excuse him for showing up on a Friday afternoon here.
Thank you, Matt.
Thanks,
Thank
Matt.
you very much, Matt. That was
Thank
very
you.
informative. Thank you.
Okay, good. Thank you.
Find the cure.
Okay, yes, sir. I'll get on it.
Yeah.
All right, bye,
See you,
guys.
Matt. See you around. See you on another Zoom soon, Matt.
Yes, sir. Probably Monday.
Yep.
All right, bye.
Okay, so thank you again. We're lucky enough to have Central Council Schools Legal Service with with us today. I've asked him to come for just to because we like to see him. We like Grant Herndon a lot. Number one, and number two, he's going to speak to CISC and a hole in our memorandum of coverage that has come to light here, along with all of the rest of this, and then speak, I think, briefly to potential relief or partial relief that may be coming down the pipeline on the liability side. Grant?
Good afternoon, everyone. Nice to see you. Thank you, Paul. And just again, we're all still absorbing these two documents from California Department of Public Health released this afternoon. So I think Mr. Constantine did a nice job on, it's just so challenging that if the timing isn't right, you know, that changes everything in terms of how you open school. If we were lucky enough to open while things are good, then the guidance says if the county later gets on the list, you don't have to close. I mean, you look at increased testing, et cetera. So it's really a timing issue. In terms of, as Mr. Miller indicated, in talking with the folks at CISC, their memorandum of coverage, there's an exclusion, and it's typical apparently in most insurance policies. It excludes coverage for what they call organic pathogens, which would include COVID. So while employee exposures are going to be covered via workers' compensation, if you bring people back and you have a claim from a student or from a visitor, unfortunately, there's not going to be insurance coverage for that. CISC was looking, and we urged them to do that, to look at, is there some kind of pool they could put together for schools, even if expensive, to give you some peace of mind that you would have coverage if you get sued. And they're finding that it just would be so expensive that it may not at all be worth your while. So we should be hearing more about that. And I think Mr. Miller's on the CISC board, so he will hear before I do, probably. The other big thing is, well, if the state is going to sort of, they're really leaning on you to get kids back to school, that's still the preference. Even with what happened today, we still have that budget trailer bill, Senate Bill 98, that says you must provide in-person instruction to the maximum extent possible. So if the state is kind of pushing you towards that, but yet you may get sued when people are exposed to COVID, and as Matt said, you're going to get positive cases, it's just inevitable. Shouldn't the state provide you with some immunity or protect you from lawsuits? So there is a bill pending. It's Assembly Bill 1384 that would provide that kind of, as long as you're following state and local guidelines, that you would be protected from lawsuits. We'd heard initially that it was having trouble gaining momentum and that a push from the federal side may be what it takes. So I know that you all know Michael Holsizer, I know, the lobbyist for the county superintendent, and he's been working with Congressman McCarthy's office, and there really has been a push at the federal level, and that looks promising. But as we sit here today, we don't have protection in terms of, you know, being able to tell you that you'd be protected if lawsuits are filed. Really hope that piece comes into place. Other states have done it. Just so that you can, you know, if you don't follow the guidelines, that's another matter, but so you can move forward within those guidelines and get kids back to school. So, Paul, is there anything else you wanted me to cover?
No, that's great. The only thing I guess I might add, if I could, is you know, coverage isn't absolute, correct, Grant? I mean, if a plaintiff's attorney files against the district, and yeah, the district was attempting to adhere to all of these difficult protocol with students, including kindergartners and first graders with masks and things, and there's a mistake, but there's a good faith effort to do, but there's a mistake. Is that a hole for perhaps a judgment, or not, if not a judgment, a plaintiff bringing a suit against the district?
If you were doing your best to follow what's out there now, do you mean, then how would you fare in a lawsuit? So that's really hard to predict, but I would say definitely the more you can follow that guidance, the better off you'll be in the event of a lawsuit. Another thing that's been challenging with all of this direction from the state is it's, you know, they call it guidance. And so a lot of it has been, well, you should do this and you should do that, and not a whole lot of you must. But yet I think you'll still be judged by the things you're recommended to do. So yeah, I think the safest thing to do is to follow that, especially the county is looking to the California Department of Health above everything else. And that they take a lot of their guidance from the CDC. So the more that you can follow California Department of Public Health guidelines, the better you'll fare in a lawsuit. And we're going to hope that you'll get some protection from the state down the line. But for now, you have to move forward in some way, and we have to plan for some in-person instruction when you can.
I have a question, Grant.
Yes.
This is Charlene here.
Hi, Charlene.
Hi. What if a teacher, for example, contracts COVID outside of the school and brings it into school and basically infects other people, but she contracted the virus outside of school? What is our liability then?
Yeah, those are going to be so hard to try and sort out, you know, because we have employees on site or kids on site for only a few hours a day, and then they're off in their personal life after that. And how do we tell where they were exposed? The teacher will be, you know, covered probably through workers' comp. I don't know if they would try to sort out whether it was a private exposure or at school exposure or not. But yeah, that's kind of another reason. If you're training staff, I don't think you're going to be held. Let's say a teacher comes in unreasonably doesn't wear a mask, and that results in that transmission. I think as long as you're doing your best to train staff to point out when they're not doing what they need to do, and you know, you're doing all those things reasonably, if something happens here and there, I would think a court would take that into account, because you can't police everybody every minute of the day. It's just not going to, it's not going to be perfect. I know that doesn't quite answer your question, but
No, it does. It does. Thank you.
I have a question. Terry Anderson, was what the governor was referring to, is that assembly bill that they're trying to go through, where he was talking about they're trying to help with that COVID coverage?
yes, that's 1384, and it's, yeah, the immunity bill. Yeah.
Okay, that's what he was referring to.
Yes.
Okay.
I have a question, Grant. I don't know all the legal jargon, but is there something that's akin to the appearance of guilt? For example, if we decide to open up and then later on students begin to get sick, could not a attorney or someone say, well, look what you guys did, because one of the largest high schools in your county, or the largest high school and the largest elementary junior high district, they didn't go back to school. So you're kind of, you're kind of the rebel against the flow. Would that be something they could argue against us?
Plaintiffs' lawyers will file cases on, they're not that they'll be successful, but you can file a claim on almost anything. I get your point, though. You have huge districts like LA Unified and San Diego saying they're not going to open. Are they establishing what's reasonable? But yet, I know from hearing around the county, we have a lot of, it's typically more the outlying districts in Kern that are looking at least a hybrid A/B type scenario.
Sure.
But yeah, I would expect a plaintiff's lawyer to introduce that evidence, what Kern High and Bakersfield City did. But they also have less flexibility than you. They have all these schools and huge amounts of huge numbers of students. So that's why the governor, I think, was trying to leave this to before today to districts to sort out, because we're all so different.
Okay.
What would the liability, excuse me, what would the liability be for the board? Because I know on rare occasions, there's been some board liability if we opened and a whole bunch of children got COVID or sick or whatever. What would the board's liability be?
So, again, it's possible in this realm that if what you did is viewed as falling below the standard of care,
right,
that hasn't really been established yet. So again, the more you're following the guidelines, if you decide to open, I think you'd want to be talking with Matt Constantine about if there is any data on the particular spread within Beardsley, and taking those reasonable steps and showing how, I know that, for example, you've ordered the plexiglass barriers. You've taken a lot of steps to help with the distancing issues. So if you're being faithful to all that, the state is still telling you have to have an in-person component. So, to a great extent, you're following what the state is telling you in SB 98. They haven't changed that yet.
okay. All right, thank you.
You're welcome.
Grant, one question, Kevin Williams again. And I don't have all the numbers in front of me, but listening to the governor's speech today, he was talking about if one student in a classroom gets diagnosed, then that classroom goes home. If another one in another class, and I don't remember the number of classes, it's 2 or 3, you have to close the school. And
yeah, go ahead. Yeah.
My question was, with Beardsley, we have 4 schools. If we close one of them, that's 25%. And at 25%, you have to close the district. So if we hit that number, which I don't know what the number is and the number of classrooms, basically we close the entire district.
So Kevin, I would just focus on the have to part where you said we have to, because my understanding of the guidance is once you're open, once you've brought kids back, that you are then not going to be required by the state to close if things happen after that. You're going to be recommended to do it, but you're not going to be required. And so they said, for example, if you have multiple cases in multiple cohorts of students, the second one was if you had at least 5% of the total number of teachers, students, and staff that are cases within a 14-day period, or if the local health officer thinks closure is warranted. But again, all of that is just recommended. So the state isn't going to force you to, and I was just on an AXA webinar right before this, and they were saying they were talking with senior staff at the governor's office. They were really trying to avoid the yo-yo effect, because when I first read this, I thought, how can we manage this in and out, in and out? And so apparently once you're up, and again, that's sounding questionable now, are we gonna have, how long is it gonna be until we're gonna be cleared to open? But once you're open, you're not required to close if you get cases after that. And then, as you said, On the district level, it's recommended once you have 25% of schools closed, but it's not required.
Right, and the only caveat to that is, even though it's recommended, going back to what we had talked about before, are we doing our best to protect the students?
And liability issues.
Right.
Yeah, I know.
Thank you.
Thanks, Ken. Grant, the other piece that just jumped in, I know Siska's working on this, but there's the liability for actions, but there's the defense, coverage for the defense of actions. And I know that doesn't exist at SIS now, but my understanding is that's being worked on. They're trying to put something together with the districts where if everybody put in money and there's a pool of assets there that they may defend districts. They wouldn't absolve anybody from a judgment, but they may pay for defense case costs.
Yes, and that last thing I heard though was that was penciling out to be really expensive for districts. Okay. But you'll probably hear more about that at your CISC meetings later this month.
Yeah. And lastly, what would you explain? In Illinois and recently California, I believe, adopted a no proof status, basically where if an employee, this kind of is germane to the question that was asked earlier, I think, but if an employee gets COVID, they don't have to show that it's from the workplace that they caught it. It's a no proof state. Am I correct on that?
I don't know that, Paul. I haven't heard that. If you see anything else on that, please shoot it to me and I'll look on my end, but I hadn't heard that. And that may be, within workers' comp law, that may be an established principle. I don't know.
Yeah, I was recent. It's Illinois and California. I found an article and I did forward it to Mr. Kuklis, it says, so I'll try to dig it up again and forward it to you.
Thank you. Appreciate it. Yeah.
Is it worth it for 3 hours a day for kids? Is it worth it?
No.
I think.
Yeah, Charlene, you're not asking me to
I'm sorry, Grant. Sorry.
Yeah, okay.
Cancel that whole comment.
Well, if there's nothing from Mr. Herndon, we'll thank him and excuse him, and so nice of him to show up on a Friday afternoon on very short notice, I might add.
Yeah, no, my pleasure. Nice to talk with you all, and good luck. I know it's so hard right now, but there'll be a way forward. There'll be a way forward.
Thanks, Grant.
All right.
Stay well.
Bye-bye.
Thank you.
Bye-bye.
Thank you very much. Okay, we'll move on to number 5.
Okay. Now we'll move on to the action section. Yes.
Okay.
Yes.
Oh, yes.
Kev.
I just have 2 public comments that were emailed to us. I don't know if you want me to read those.
That's fine. Were they staff or were they other?
They were staff, but they were under the public comment link.
Good. That's fine. That's go ahead. Go ahead, Kevin.
Read them.
First one just says, every day brings a new chapter to the steps of reopening schools. I suggest that we reopen with the health and safety of our school population in mind. That is why I am advocating the distance learning model with the goal of fully reopening in increments as health dangers subside. Thank you all for your hard work and dedication to our district. Sincerely, Ernie Lewis, science teacher, Beardsley Junior High School. Second comment, Beardsley School Board, I feel it is important for there to be some student presence at school if at all possible. Teachers need an opportunity to meet and assess their students. As a music teacher, it is almost impossible to teach band and choir without students at school with instruments. There are many ways we can adjust scheduling for music classes, but the students must be present for this to happen. I understand the need for a safe environment for both staff and students, and I think that can be accomplished with one of the schedules the district originally looked at. Thanks for the opportunities to express my thoughts. Wishing you the best as you make decisions for the Beardsley District. Jim Young, Beardsley Music.
Okay.
Thank you, Kevin. Anyone else?
I have a comment. I don't know if you would like for me to read it now, or do you want me to wait for later in the agenda?
You know, Lisa, if you would, we've got certificated comments on number 8, and we're going to open up number 5 in a minute to public hearing if it's related.
Okay.
Yeah,
Sounds good.
we'll hear from you, but we're not ignoring you.
Thanks.
Okay, with that being said, we'll go to number 5. We need to go into a public hearing, which we are now in. The board will invite public comments on the reopening of the district schools on a virtual learning model with staff working from sites Monday through Friday for the start of institutional year beginning on August 12th based on current public health conditions. The plan includes flexibility based on state and local public health guidance to adopt a hybrid protocol/procedure plan when conditions are appropriate. And we do have an exhibit.
And you can mention that we're going to table both these, but I want to go through all the documents.
Yes. And I need a motion because we're going to table both A and B, and then we will be coming back on July 30th, I believe, to move forward on them or make a somewhat final decision. But do we have a motion?
I so move.
Was Terry, I think. Was that Charlotte?
That's Charlene. I move.
I'll second. This is Gina.
Thanks, Gina. Thanks, Charlene.
Okay, so thank you. So I do want to go through all the items related to 5A. We just won't vote on it. I want to go through some plans, and Mr. Williams will dovetail in at a certain point. And I want to show everybody where we are now. We've done a lot of work towards different models. So if we could, Ryan, go to the main PowerPoint, the green one in the middle. Okay, you can go forward slide if you would. So this number of slides here, this all has to do with reopening schools process. Here are some considerations that both Matt and Grant a little bit talked to about. We are partners with the California Department of Public Health and the California Department of Education in our decisions moving forward. They set the protocol along with Kern County Health Department, which Matt is the leader of. So in our planning, plans that I'm going to show you, we take great care in embedding their recommendations in all of this. It's threaded throughout all of our documents. Again, that last bullet, Matt touched on a little bit. They're currently reporting a little bit of a surge in positive cases. Next slide, Ryan. Guiding principles. These are some things we looked at and thought about as we went forward. We partnered with Kern County Superintendent of Schools a great deal on this. And as a sort of a group or consortium of superintendents, we came with some guiding principles moving forward. There are guiding principles contemplating health and safety, which says follow the guidelines, right? Student engagement and achievement, mental and emotional awareness, and access and equity. A big one on access and equity, which I'll talk about later, is ensuring that all our students and families have the opportunity, if we are going on a distance learning model, to have access to the material. And that's going to require technology. Next slide. Grant already went over this, and we just talked about this, but again, it just is a reality right now. We do not have in a memorandum coverage for the coronavirus as it applies to students. Ryan, you can switch. Thank you. Here are some of the broad categories when we took a look at reopening. A lot of different considerations. Again, health and safety, student engagement, operations, right? All our departments, nutrition, transportation, the mental health of our students, again, the access issue or the digital divide, as some refer to it as, and a lot of other additional considerations. Surveyed our parents, and that's still ongoing. That is still open. They are still being surveyed at this point. And Mrs. Auger and I, mostly Mrs. Auger, have surveyed the staff on hybrid models, which one that they thought would be best for instruction. Health and safety measures. And so these would apply to our classrooms, although this morning or this afternoon, we got some new guidance, which is not reflected in this. Obviously, we just got that guidance 2 hours ago. But a lot of it is the same from what I can tell now. We're going to want to go back and look at that. Social distancing, 6-foot rule for students, hand washing procedures, facial coverings. Matt just talked at length about those. Plexiglass, glass shields for reading tables, school offices, cafeterias, which we've purchased at this point. Hand sanitizers, disinfecting procedures and policies. We are purchasing spraying systems, which are on what they call the M list for cleaning classrooms quickly and efficiently. And a district plan, which we'll go to in a minute, on dealing with symptoms of any employees. And then training, which will involve different people, including our registered nurse. Okay, so this is model 1 or phase 1. I'm going to refer to phases because the California disease control refers to phases. So phase 1 would look something like this. This is what we could be forced into. As Matt just talked about, without any election to do it, we may be forced into this. Students would work remotely from home entirely. We would utilize Google Classroom for that. We'll talk a lot more about that coming up today and in the coming weeks. Accessibility of devices and connectivity would require distance support with our families. Distance learning coordinator teacher, we're taking a look at establishing that tonight if approved, and that individual would work with staff and families as we need to, as we navigate these new waters. Students would meet each day with using Google Meet on district prepared schedules. That is would be uniform throughout the district and supervised by site administration. And Mr. Williams is going to talk more about that in just a few minutes here. Teachers would work from their classrooms Monday through Friday under the plan, if it's a distance learning phase 1 a situation that we're under. And Mr. Williams, you want to talk a little bit about what we're working on now in terms of the instructional plan and some days for teachers here coming up in July.
Right. I think it's important that everyone understands, first off, that I think everyone pretty much on this call, watching on YouTube and everywhere else, prefers in-classroom instruction. That's the way to go. That's where the most learning is going to happen. However, it has to be safe. And when we determine it's safe, then hopefully that's what we'll be doing. Until then, up to the board eventually. If we do a distance learning model, then I think we're much more prepared now than we were March 17th to do that. We have plenty of devices that we can send home with students. We've prepared with, now my brain will go blank. The wireless devices, Ryan, that the hotspots, there we go, hotspots that we can provide students for learning. We plan on offering some professional development to our staff. We've already talked about the Google Educator Level 1, and several teachers not only have taken the 13 units of training, but they've passed the test. They've become Level 1 certified, so that's great. And coming up on the 27th of this month, I think it was the 27th, Paul?
It's 28th, Monday and Tuesday, 28th, 29th, maybe.
27th, 28th.
There you go.
27th and 28th, we are planning on having some more training in the area of Google. How, one of the difficulties that we've been working on is that first day with students. How are we going to get the students connected on the first day? And Ryan and I and some other people have been working on that. It's getting easier. We're mapping it out, and I think we're going to be successful in the end. We'll get students in classrooms, determine which teacher they're assigned. The teacher will have a special code, and we'll go from there. So like I said, I think our strategies are a lot better put in place right now than they were back in March.
Very good. And also, Kevin, if you could expand just a little bit more on, for the hybrid model, the district level plans we're putting together for instruction schedules and oversight and all those sorts of things that we would present to the staff, teachers on July 28th at that, I'll call it.
Can I ask a question real quick on distance learning? I never heard exactly how many students participated from March till June, how many people, and what we're going to do about those that did not participate as we start into the new year.
Right. At this time, we don't have a count of who participated with that distance learning. There was no roll call or requirement for checking attendance. Moving forward, we have a plan for that, and there will be roles. Students will be held accountable for checking in and meeting with their teacher online. And we have a definite plan for that now. Well, Terry, unfortunately, to answer your question, we don't have a number.
Don't the teachers have a good idea of which students during that time didn't participate?
Sure, I'm sure each of the teachers do have a pretty good idea of who participated, or at least a pretty good ratio. Some students participated all the time, some were hit and miss, and then others did not participate.
Yeah, I'm sure. And I'm sure as time went on, it became harder and harder for them.
Right, they dropped off.
So we've got to be very diligent in how we're going to keep track and keep them on task. And
most definitely.
How can we actually make the students accountable for, I know they have to go to school. I mean, they have to go to school physically, legally, but how can we force them to go to school online? How do we make it accountable?
Well, we're going to make sure that every student has a device that has internet connectivity. So whether they have one now at home or the district provides one to them, that's going to be taken care of. So that wasn't necessarily taken care of the first go round. That will happen this time for sure. We're coming up with a time, whether it's 8:30 or 9 a.m. every morning. School is going to open and every student is going to be required. This is, of course, in a distance learning model I'm talking
right.
They will be required to be logged in with their teacher. The teacher will take roll, and the assignments that they're doing with Google Classroom will get graded, and that's how the grades will be determined.
Okay, how will that affect our P2?
Kevin, if you mind, I'll get on that one. Is that okay?
Yeah.
I have another question too concerning though, before, if you don't mind.
Go ahead. Yeah, go ahead.
Being realistic, we have quite a few parents who are not as involved as we would wish they would be. And so we have to be realistic in the fact that we may have some who do not have their children involved and accountable. So we have to have some kind of measure that would be encouraging the parent. How are we going to do that?
I think the position that is going to be talked about later in this meeting, that's going to be one of the responsibilities for that person. and our community specialist to make contact with those homes, see what we need, see what we can and need to do to make sure that all of our students are connected. It'd be the same situation as if the student wasn't coming to school. And I know, Ms. Anderson, it's probably a larger number rather than a smaller one that they were visiting this last year. You know, we had some protocols where we had our community specialists go out. If that wasn't successful, we had a deputy, and we had SARB meetings. So there are protocols in place that we will chase that down. But I think, like I said, we're in a better situation right now than we were in March.
That's good. I'm glad that we had that community specialist on board working, because she's going to have a lot more ahead of her.
Might be
She's
real.
going to have a lot to do, that's for sure.
Yeah, so now at least she's kind of got her feet wet, and we'll know that it's going to be a bigger job with this.
Kevin, I have a question.
And extended.
Sure, I think it was Gina.
Yeah. When you said all the students having a Chromebook, so kindergarten, first grade, we're all going to be one-to-one?
Yes, and if there's multiple students in one family, you know, sometimes there is a device at home that the family uses. And originally we were thinking of having them share that. I'm talking originally in March. That just doesn't work. So
right.
We'll make sure that each student in the household has a device.
Okay, thank you.
Kevin, yeah, if you could just, if there's no other questions on that one, if you could just expand a little bit more on the plan we're working on and the Monday, Tuesday, and the Zoom with staff and things like that, just so everybody kind of knows where we're going.
Okay, and then you're going to get back to Charlene's question on the P2, right?
I will.
Okay. Just so if staff members are watching, on the 27th, we are going to have a Zoom professional development, and it is for staff. And we'll be talking about that form letter that I described a couple minutes ago, and what the form letter says, how the teacher will develop their own Google Meet meeting or orientation, where you will have all the kids log in and talk about the times, because times for synchronous instruction, meaning real-time instruction with their teacher, is going to vary greatly by grade level. You know, from a very short time for kindergarten, first, second graders to, you know, maybe up to an hour and a half for junior high students before we have a break. So we've got something worked out, and we're going to still communicate with our teachers a little bit more, making sure that we have the correct attention span time limits in the document.
Okay.
So Kevin, if I could ask you a question. So you're going to meet on the 27th, is that correct? Or in the Zoom?
With teachers.
And that meeting is to discuss a distance learning opening?
It'll be used to discuss any type of opening that we actually decide on, but yes, distance learning or a hybrid, because hybrid will include a little bit of distance learning as well.
Sure.
I think they've got down their classroom instruction. So anything that's remote instruction, that's what we'll talk about on the 27th.
Okay. I'm just thinking there's not a lot of lag time. If we postpone our decision on what we want to do, that kind of shortens the preparation time teachers might have if they do go to hybrid or if they go to distance.
Yeah, Ken, that's a good point. I think the two are going to be so wrapped up together, right? So if you're planning for a pure remote learning situation, that would be 5 days. The hybrid's still going to contain 3 days remote learning, right? The Wednesday, Thursday, and Friday for one group, and the Monday, Tuesday, Wednesday for the other. And so what we would do is put together a plan that for both of those scenarios, and bring it back to the Board of Trustees on the 30th, July 30th. I don't know if that answers your question.
Okay. Okay.
Yeah, we would, and I'll talk a little bit more about that here down the road. But Charlene, on your P2 question, we're held harmless on the P2 for this year. There's waivers on attendance. So we're held harmless, and the P2 from the end of last February, when they cut it off, is the number we get for funding, which worked out well for the district because we're at 93 kids for the year. So we're held harmless. In other words, this year cannot count against us on attendance.
Okay, I wondered because I knew we were not held harmless in the beginning, but now with teachers actually taking some kind of roll call, I didn't know if the state maybe had backed off of that and is requiring school districts to have more accountability in who's attending and who is not.
Yeah, and it will. Yeah, and the state, the governor's come out with mandates to take attendance and pursue that very aggressively with the remote learning. There's no legislation on that required to do that. Kevin had said earlier we weren't, that was right, but now it is. It's changed. So.
Okay, thank you.
Okay, so moving on to the next slide, Ryan. Phase 2. Sorry.
Phase 2.
Next slide. There it is. Okay, so here is the hybrid model, on-campus and distance learning approaches combined. And in this format, you would see students on an AB format. Half the class would attend on Monday and Tuesday. We would call them the A group. The other half on Thursdays and Fridays, we would call them the B group. So you would have class sizes on Monday and Tuesday and Thursday and Friday. And again, the reason for that is all the protocols. We can't follow the protocols in the classrooms that are required by the health professionals without splitting the class. So you open up fully a class, 28, 29 kids, you can't follow the protocols. Logistically, it's not possible. So that's the reason for a hybrid model. Again, some kids, half the class would attend Monday, Tuesday, the other half Thursday, Friday. Wednesdays in the middle would be a distance learning day, a day to deep clean the rooms, and a day for preparation for teachers also. So the Wednesday in the middle would be, they wouldn't be physically here on the Wednesday under this model. Cohort class sizes would be much smaller, of course, 8 to 10, 11 kids per class at the elementary level. There at junior high would vary with only half the students attending at once, as I mentioned earlier, to conform again to California Department of Health guidelines, 6 feet of separation, et cetera, all the other requirements, and on the buses as well. Wednesday distance learning day for all students. Students to stay with their cohort to the maximum extent possible under the regulations, much more contained environments. You want the same groups staying together. You don't want them moving around and creating new groups. Model allows, again, for cleaning between the A and B groups on Wednesdays. You would move to full instruction full instruction would be the next move, which would be phase 3 if health guides allowed. And we just heard from Mr. Constantine that sounds unlikely, but if it did, that would be the next move. And Ryan, would you go to the second PowerPoint now? I'm going to go pretty in depth into the hybrid model now. This is a procedural document on what to do in a lot of different situations with respect to COVID. It, again, is an AABB model. You can go to the next slide, Ryan. Okay, so here's what it would look like on this model. Again, Monday and Tuesday, kids on the A group. At the top there, kids physically come to school. Wednesday's a distance learning, deep cleaning day, and then distance learning for that group on Thursday and Friday. So there's still 3 days of distance learning. They're here 2 days. On the B
Paul,
schedule.
can I interrupt you right there?
Yes.
So on schedule A, you've got the kids going to school Monday and Tuesday.
Yes.
Which means the B kids are doing distance learning Monday and Tuesday.
Yes.
Is there a time frame? Because the teacher that's teaching the in-school kids is the same teacher doing the distance learning, correct?
Yep.
And at what point would they be doing this distance learning?
Yeah, we're still taking a look at that, Ken. That's a great question.
Okay.
We would likely look at abbreviating the days some, probably.
Okay.
To allow for a little bit more time for the teachers, especially
Sure.
TK through third, right? And 4, 5,
Right.
6. We would stagger the releases due to the need to do so for social distancing on the buses. But yeah, that's a challenge. You've identified a definite challenge to this.
Yeah, okay.
Well, there's also a challenge though for the teachers because they could have actually 1, 2, 3, 4 different programs teaching 4 different, I mean, it'll be the same group every time, but class Monday and Tuesday is not going to necessarily keep up with class that's distant learning. So they can actually have 4 different schedules, classes, format, however you want to call it, to teach in a week's time. That's
It is. It's got none of these are perfect systems. That's for sure. It's difficult. But I think that's.
And my other question would be that if you've got the kids that are, say, for example, they're doing the distance learning, and there's a section that they begin to struggle on, are they going to be able to show up on their in-person day and say, I know we're supposed to be on number D, but I'm still struggling with number B?
Yeah.
Yeah, I mean, yeah, we're gonna have to be able to reach back like that to a certain degree. So another
Okay.
challenge. Yep, absolutely. I think that's gonna obviously happen. So
well, obviously kids will not, they won't be able to progress through the learning.
No.
right. Yeah,
I have a question. It's Gina.
Gina.
For the hybrid learning also, what if you have students who choose to do distant, parents or families that say, hey, we're going to do distance learning, we're not going to come to school? Do they still have that option? And
Yes,
what do
they
you
do.
do with those kids?
No, we're gonna offer that option. Yeah, and that could happen. I think we'll have maybe a small percentage as students that choose not to come to school.
So you'll have a teacher that has to do the hybrid, but then also deal with the student who's 100% distance learning? Or is there going to be a teacher just for those kids?
Yeah, well, yeah, I mean, they're gonna have to deal with it, right? But this position that we're hoping to approve later today is gonna be helping on that too, because that's gonna be a school teacher. So that would be part of their duties to try to be a liaison on some of that.
So do you have all of your teachers on board that, I mean, are there any teachers that say, I'm not going to be coming back to school, I'd rather just teach distance learning? So that way you have teachers that, I don't know, I'm kind of confused that, I mean, if you do have, are all your teachers coming back?
We don't know that yet. Yeah, if teachers have individual concerns related to COVID, they would approach my office on that. We would talk to them. We would look to in those cases, utilize them in the capacity that you're alluding to, basically working with students off campus. If in fact that, you know, we had teachers in that category, which we may.
You don't know if you have teachers in that category yet.
Well, I'm sure they do.
Well,
I'm sure they have teachers in that category.
You know, sure, Mrs. Battles, I'm sure we do, but we haven't identified those teachers yet. So we'll have a process for that coming up.
Okay.
Yeah.
Right.
I have a
know.
question.
Go ahead, Terry.
No, that's,
Terry. Go ahead.
I just wanted Mrs. O'Day to address it if she's got a vision of how it might go.
I'm sorry, do I have a vision of how the hybrid will go, or how
you're going to approach
how I'm going to approach what? I'm sorry.
Your teaching with this hybrid model, how you think it's going to go with your new, teach some with the Monday, the A schedule and the B schedule. And
right. Well, it certainly seems challenging, right? It's kind of like two jobs, right?
Yes.
And so I mean, we certainly haven't made a deal or anything like that, but I kind of feel that it would be doable for me anyway. I'm just speaking for Lisa, not as president. I could teach my physical students until lunchtime, I would like to send them home with a sack lunch and their breakfast for the next day. And then I would like to eat lunch. And then I would get on the computer and touch base with my distance learning students, and then wrap that up and get ready for the next day. That's how Lisa Auger feels comfortable with that. If there are no germs around me.
That, yeah. Well, that's how I just want to see your vision. If you kind of thought it through.
Yeah, there's absolutely no way that we could keep them there past lunch and then connect with those online. I don't see how to do that.
Right.
And not, I mean, teaching is a stressful job, right? Okay, right. And teaching students that are trying, that have to wear a mask all day. We have to wear a mask all day. There's so many added stressors on top of just the regular stressful job. So I don't see how we could do it past, I think they need to go home at lunch.
Okay.
Yeah, I see your point, Lisa.
Thank
And
you.
besides, every child down to kindergarten level has got a cell phone that has a camera.
Yeah.
And all it takes is 2 or 3 kids to take a picture of a teacher without a mask or kids in the classroom without a mask. And you're right back to the first problem we talked about on liability, which is huge.
Right. Yeah. So that's where I'm at with that. And I'm talking about junior high kids. My gosh, if I was back in my first grade classroom, there would even be extra stress. So,
I can't even imagine, Lisa.
Yeah.
I can't imagine.
Which brings me to a different point. So you've got kids that are showing up to class Monday and Tuesday.
Right.
And as we all know, kids can only sit for so long, then they need to go to the restroom. Is there going to be some sort of monitoring social distancing situation with restroom breaks?
Right. Mr. Miller and my BTA leadership team, we were able to have a meeting, and he invited Amy McCoy, the new director of MOT. And I actually felt a ton better after hearing different protocols and different PPE that has already been purchased. And then I kind of freaked out watching TV the other day where hospitals again are running out of PPE. So that I text Paul real fast. I'm like, please tell me this stuff is in the warehouse. I don't want to be one of these hospitals, like a hospital.
Right.
And so, I mean, it seems that we do have, PPE and stuff, but yeah. But she mentioned the bathrooms. She mentioned extra hand washing, sink areas, all the different things that they have purchased for us. And I do appreciate that. But it's still hard.
Yeah. Okay.
Thank you.
Yes.
Thank you, Lisa.
Thank you.
Okay, thanks, Lisa. Yeah, so that's a picture of the model and the hybrid that you hear about that has been contemplated here last month or two by a lot of different districts. Down on the left corner, there's some nice links there for staff or parents. CDC's consideration for schools, and Stronger Together, which is a document that deals with a lot of the COVID-related challenges. Right.
A question regarding junior high, especially with Jim Young. If you are on the hybrid model, is there going to be the opportunity for him to conduct choir and conduct band with such a split in his kids?
Yeah, well, there's 2 challenges there, Ken. There's the split, and then there's the protocol. All the protocol with regard to singing in closed spaces and playing instruments and things like that. So we would have to be creative. He wouldn't have his whole class there on this model. So yeah, that you identified a challenge there.
Okay.
All the band, unfortunately, all extended activities have been canceled for the year, including all band performances and competitions and choir, which is highly, highly unfortunate, obviously. But yeah, they're gone. So.
Yeah.
Yeah, so it's, Mr. Hilton, you're on the call still. Maybe you could talk a little bit about the schedule that you've been working on, the hybrid. You put a ton of work into it, I know. Maybe you could address that just a little bit.
He sent me a text that he had to step out.
Okay, yeah, thank you. Thank you, Lisa. Okay. Okay, so the next slide, promoting behaviors that reduce spread. So what I have here is kind of a flow chart. You see on the left side, there is for staff and students, when should you stay home? And there's a list of those there. And a couple links to the CDC again. I think the same two links prior slide. To the right side shows a couple flow charts. The one on the left, parents contact the school office if you know they've got a COVID concern, and then the attendance advocate out of Kevin's office would report to the site administrator and ultimately to Mrs. Wessner in my office and the school nurse. Moving down the protocol chart there, site administration identifies that the student will need distance learning as a result of potential COVID exposure. On the right is staff contact site administration, and another flow chart there that kind of calls out the protocol basically for those situations. Staying home symptoms are listed at the bottom, and you got some bullet points down there for use for staff and parents. And symptoms of COVID, there's a link there. So this would be protocol for the hybrid model. Ryan, do you want to? Yeah. Okay, so here's the three phases we were talking about. The CDC calls out. Now this is changing because now we got some new guidelines this afternoon. But so phase one is school closure. Say the governor calls a closure with substantial spread, due to substantial spread, what the CDC calls substantial spread. You go to a distance remote learning environment. And then the other permutations down below: targeted closure, would it be a school, would it be a classroom, or a short-term closure or extended closures. In the middle is phase two with a minimal spread, and that would be that hybrid model we just looked at. That would be possible there in phase two. And under the new guidelines, you know, that may be taken away from us here, depending on whether we can go 14 days in a row, meet those requirements. Phase three is a traditional, the spread's greatly reduced, or there's no spread, and we go back to traditional classrooms. That's just a flow chart that shows the three models. There's a little black, I think I can read around that, Ryan. Practice, prevention, preparing for school. This again is just, it's a protocol slide, supplies and signage that we purchased most of to deal with if the kids are gonna be back on campus. And there are all kinds of requirements passed down. This page incorporates many or all of them, and you can go down sanitizer stations, calls out face coverings, calls out screening stations, and water faucets under the protocol out in the common areas would be shut down. So we're gonna have to have other water sources for the children. Cleaning supply availability, number 6. Number 7 goes into equipment, and number 8, provide other protective equipment as appropriate for work assignments, right? So this calls all that out. On the left, phase 2, minimal spread, district, school considerations, series of considerations there that we've added, and a couple of links at the bottom.
So at this point, Paul, there's no
Go back up, Ryan.
consideration or protocol for, for example, the forehead thermometers, checking each student as they come to school that day, or we're just going to kind of, if you've got symptoms.
Now there is, there's going to be, so at the bus stops, for example, we're going to have bus marshals on those buses. They're going to take the temperature. If the child has a temperature, they will put in a certain designated area on the bus. Kids coming to school on the bridge side or coming on the office side, they will have their temperatures checked as CDC protocol. We finally, we went through, Kevin can tell you for sure, we went through 5 or 6 different temperature gauging instruments, if you will, and we finally found one that works and works quickly, I think.
Okay.
So yeah, that's definitely part of the protocol, and we'll touch on it more in some future slides here. But
okay,
when we get to transportation.
Where would these marshals come from?
We floated, well, from in the past, we've had marshals on certain buses. Most likely in North Beardsley in years past, we had a couple challenging buses. So we'd have one bus marshal or bus aid, if you want to refer to them as that. So now we floated positions for each of the buses. We floated it inside to see which current employees might be interested in serving that capacity in the morning and afternoon on the buses. And after that, if we don't find enough people to cover it, we would go outside and find some people to do it.
One per bus?
Yes, yes.
Okay.
And keep in mind, Mrs. Anderson, the buses under this model would be half the normal run.
Right.
You know,
Right.
so and it's still, even with that, it's gonna be difficult to meet the social distancing requirements of 6 feet on those buses. So it's gonna be a challenge. So we added the bus marshal to ensure that, for example, the kids keeping their masks on the bus run in and the bus runs going home.
Would
Yeah.
this be these marshals, would this be in addition to someone's duties, or is this separate positions?
It would be a separate position, right? So they'd be adding to their hours if internal people wanted them.
Okay.
And that's our preference, right? If we have internal people want to do that, then we would like to use them. So those positions are floated, and it would be morning and afternoon pieces. And if we stagger the releases, say K through 3, 4 through 6, 7 through 8, then we'd be marshals on those buses.
And would that be something the board would have to vote on, or is that something we can just do internally?
Now, we would do that internally. We already have the position, so
Okay.
it exists.
Would,
So we don't
would
have.
would we have enough time to clean the buses between?
Yeah.
Oh,
So
yeah, because we'd only have morning class and then distance in the afternoon, right?
yeah. So when we stack, yeah, it's just confusing. So the morning bus, right? We're going to have time to come park them. The buses, if we stagger the releases, the same bus isn't going to get used by different cohorts. So then we would just clean them at the end of the day.
Right, okay. All right.
Good question, though. Yeah, there's a lot of pieces to this.
Thousands.
Yes.
And once we start implementing it, it's like anything else that you do for the first time. What looked good on paper is not going to look good when you try to do it.
Oh,
So there's going to have to be a lot of changing, working with it, and I hope everybody understands that.
Yeah, no, that's the point well taken. Yeah, it's going to, first week or so is going to be ironing out things along with the normal challenges of starting a year on buses that are there anyway. So, yeah.
Paul, I have a question.
Yes.
This is Gina.
Yeah.
On underneath the yellow category, number 5, all water fountains will be turned off at every school site, but
Right.
bottles will be allowed from home. Then it says B, disposable cups to students who forget those. Where are they getting water for that disposable cup if the water fountains are turned off?
Bottled water.
Yeah, it's going to be bottled water. We're going to have to bring in bottled water on that. Yeah,
Has to
the reason, yeah, Gina, the reason, obviously, I know you know this, the reason we can't use water faucets, right, is they're going up and grabbing the faucets. Right. So yeah, with the COVID, we can't do that. So that's a requirement by the CDE, the California Department of Health, and local authorities, basically.
So in every classroom, there'll be bottled water?
Yeah, that's what we're going to have to do. Yep.
All right.
Yes, that's a lot. I know these slides have a lot of information. People can read them. I won't read through all of them, but you can see the level of complexity of this, of having kids back on campus and meeting the guidelines. So this I guess illustrates that. Ryan, you want to move on? Okay, practicing prevention, staff training, and information. Each site at the top on the yellow band is going to need to have an isolation room, which we're preparing for now. We're purchasing a partial portable at San Lorenzo to make that happen. And we're making provisions at each of the sites for this in case there's a COVID suspected situation. And that's by CDC regulations as well. That's got to be there. There's a video clip there in CDC guidelines related to that isolation room there for people to access if they choose to do so. We'll post this on the website, this document. Maintenance, Cal OSHA, of course, is our governing body there, and there's all kinds of requirements for PPE requirements, mandates. So there's masks, there's shields. We purchased all kinds of barriers for kidney tables where you do guided reading, and for other areas, office areas and such. Students and staff, these are some things to teach and reinforce if in fact kids are going to be on campus or back on campus. Hand washing, nice clips there, video clips. hand sanitizing, face coverings, cough and sneeze, procedures there to limit the spread, basically. Social distancing, 6 feet the rule. What you do if you feel sick, and there's a clip there. So pretty detailed there. On the left side, you've got some considerations really that the district and sites would think about listed there, and then a link at the bottom on social distancing. Okay, entering school buildings or other areas on campus. Signage at the school entrance, we've got to do that. And you can see some of the elements there, A through E, that would be covered. Passive screening there, and a link for parents and staff. Active screening checkpoints, and we list some of those there. Temperature stations, which Mr. Burkus asked about a little bit earlier. We've got no-touch thermometers that we purchased finally after testing half a dozen of them. If the temperature is not above 100 and 100.4, then or if above, that says not, but if it is above on the alternative, if it's above that, then we've got a situation, and that's CDC protocol. If the temperature again below there is above that, there's a bunch of protocol there that we've got to go through at the checking stations. That would be the entrance to the schools, the buses as we pick them up, and all our entry points. School nursing information in the right corner there, and a link. On the left side, the blue side, phase 2, which this is that phase, right? Hybrid, some recommendations there for district and school sites, district level and school sites, which I would let everybody read. There's quite a bit of good information there. Did you change slides? Yeah.
Yeah.
Okay, continue. So entering buildings, school buildings and staff. Again, more protocol for entering buildings. Passive screenings, active screenings on the left side, more considerations regard to signage, protocol for students and staff with symptoms, marks on the floor areas separating kids and or staff or parents on the 6-foot requirements there, and screening students and staff to the extent practical there in the blue recommendation box on that one. So that again is the second slide on entering school buildings. Campus access, outside visitors and groups, bunch of protocol for that. And so, you know, it's got to be controlled if parents are coming to the offices and things like that. And so district, right down to district deliveries, there's protocol for that. You can see there if someone's delivering items to the school district at the MOT barn out there. All right, serving meals, nutrition protocol, and there's a whole litany of things there that Anna's been working on for 2 months, anticipating a hybrid model that we've been looking at. And so you can see a number of things there. One that's particularly interesting that's recommended is serving meals in the classrooms. We bring the food to them, so they're not congregating where? In the cafeteria. And so that's the strategy there. Lunch would be modified schedules so that we can maintain social distancing in the cafeterias. So we're going to have a lot of different times that students go to lunch to adhere to the requirements, the 6-foot requirements, which are an absolute requirement, including under the new governor's discussion today. That was not relaxed today, the 6-foot. Okay, transitioning students from one place to another, hallways, those sorts of things, limited mixing, of course. ELD students, English language learners, would stay in their homeroom and we would come to them with the tutoring, right? Because we don't want them mixing in cohorts. Students stay with their classroom to minimize contact with others to the extent possible. That's difficult, right? Particularly at the junior high. RTI intervention, which that's our students who need help in math and reading. Again, that would be push in. So they would push in and work with the students. And again, we've purchased plexiglass systems for the reading tables to separate students from teachers, which is protocol as well. Music to be determined by site, and PE to be determined by site. There are a lot of restrictions in those 2 areas with the code, just as a practical matter. But, you know, got to get creative. We got to do the best we can. only movement. And you can see the situations there down at the bottom. Students on IEPs leave to receive services such as RSP and speech. That's mandated by law. They have to receive their services. They're on IEPs. Cohorts to be kept together for pullout whenever possible, based on schedules developed by the RSP teacher and the speech teachers. Part of what me and Mr. Williams and I are working on is all the instructional side of that and the protocol for special ed teachers, which we bring back to the board as a plan on July 30th. That would be incorporated in the curriculum. So special ed's a big area there. It's called free and appropriate public education. We have to adhere to that in this situation, in all situations. And again, at the bottom, junior high students attend their classes with their cohort groups. Dave has done a tremendous amount of work on working out how to do this at the junior high if we in fact go to a hybrid situation. And again, I thank him for a lot of work. All the principals work very hard on this. And as we move along here, district school considerations, left side, minimal spread, and there's just some more considerations related to transitioning from one place to another.
Paul, I got a question, and I looked on my packet to kind of go back, but regarding the meal plan, and isn't that a little dangerous to be serving the meals to the kids in the classroom? They got to take their masks off, which invariably could expose.
It is. I mean, but you know, Ken, yeah, I mean, if they're in the cafeteria, you know, we're going to have the 6 feet right at the tables.
Right.
We're going to stagger it. In the classrooms, it will be the same. You'll have half the kids in there, but it absolutely is dangerous. Yeah. I mean, there's a chance for, you know, they got to pull their mask off to eat, right? So you go
perfect scenario.
Couldn't they wait? Couldn't they wait and eat their meal at home?
No, Charlene, yeah, that's a really good question. We're required by law, Title I law, to feed the students. So yeah, there's not wiggle room on the school supplying meals, but good question. Yeah, but Ken, back to your question. Yeah, that is sure, that's a difficulty in the situation there. Just another one.
All right.
Yeah, good question. Okay, so and again, on the left side, we have, you know, considerations. We've kind of kept that through all the slides. Yeah, thank you. Conducting large group gatherings, right? They're basically out, most of them, by edict from all the health professionals and the CDE. So gatherings such as assemblies and all the fun things that enrich it for the kids that are canceled. You can't aggregate people in groups if they're not six feet of separation. You know, so we talk about staff meetings a little bit there, right? We've all gotten really used to Zoom, so I'm assuming we're going to use an awful lot of that. But if the staff held their staff meeting in the cafeteria and could adhere to the 6 feet, then that would be another option. Again, just on the left side, I won't read all those, but there are a lot of considerations there. Bottom one, sites to have adequate staff oversight during morning arrival and student dismissal times to regulate student behaviors. Right, so that's really hard too. We're responsible for them to and from school. So if they walk legally, so if they're walking home, you know, how do we regulate that? I don't have an answer. So yeah. I just do not have an answer for that. I wish I did. We can control them on the buses, you know, but when they get off the bus, they got to walk home. We still got the to and from rule. So
you can try to control them on the buses.
yeah. I mean, you know, that's where we're getting the marshals. I mean, and again, they're totally required. We are we have to, we are mandated to make sure they wear the masks on the buses. Bottom line. So, okay, Ryan, there's a lot of slides, I know. Bear with me. Supporting teaching and learning. This relates to teaching and learning. After receiving health professionals' recommendations, the following AB hybrid schedule, you know, would be chosen, you know, if that were an option, if we're not closed, and we decided to do that. And again, this reiterates kind of the hybrid model that we talked about, the AABB model. Students will continue their learning via distance model for the other 3 days, which again presents a ton of challenges that we are well chronicled and were brought up earlier. Grade levels will collaborate with distance learning teachers to develop instructional plans. And we're going to do, as I said before, we're working on a district-wide plan for delivery, for schedules and a whole lot of other things and what roles people need to play and who's responsible for what. And we will have that again, and we will share that with the teachers who are able to attend on July 27th and the 28th. And so we'll go through all those plans with them and vet it through them before we bring it to the board. And the site administrators obviously will be involved in the entire process. So we would do that, and we would bring that back to the board as a hybrid plan on the instructional side. Again, what we're looking at here is procedural stuff. This isn't that's necessarily the instructional side, obviously. Ryan, does that click through, or is that the same slide?
Exactly.
Okay, so here is another look at the hybrid schedule. We've already reviewed that, so we can move on. Ryan, we can move on to the next slide, yeah, unless you have a quick. Okay, protecting vulnerable populations, right? So that was alluded to a little bit. Staff, here's how we think this could go. And of course, they can contact my office, Mrs. Wessner, but staff who have concerns about COVID, which we're going to have some, right? They would contact us, and we would talk to them very confidentially about that. And you can see there the HR coordinator, they would meet with her, and I would be involved, of course, too, in all of those. Students, distance learning, if they've got concerns or they're vulnerable, right, they're going to go straight to a distance learning format, which again is going to present challenges. The teacher's already doing all the other things we talked about on this model, right, are trying to do their best at it. And so here's another challenge served up for us. There'll be some students that are going to stay home either electively or based on vulnerabilities. So that's sort of, number two, something we've got to deal with for health and safety reasons. Number three, confidentiality. Of course, it's confidential. So that goes without saying on any concerns there with students or staff, any staff. And
So
again, I'm sorry.
I have a question. This new position that we're floating, she's mainly going to be working with the teachers, not with the students.
No, it's going to be everything, Terry. Yeah, it's going to be what we need them to do. Yeah, so they would be working with teachers, students, parents. I can imagine, for example, in a scenario where a student doesn't have Wi-Fi or a family doesn't have Wi-Fi, could be phone conversations helping them establish that with Mr. Frank's office, teaming with them. So as we get to that job description, you'll see it's pretty broad.
I don't think you're going to find somebody that wants to do this.
That might be the case. We're going to find out if it's approved. So
if you had a small population that wanted to do strictly, due to vulnerable or whatever, she might be able to just take that. Who knows?
Yeah, Terry, all those kinds of situations, we would want flexibility with that person. So, and obviously great technology skills and the other things that we'll review on that app. But yeah, that'll be a challenging and a good challenge for somebody who likes challenges. Let's put it that way.
Yeah, because you want to take off as much from the teachers as you can. They can't do everything.
Absolutely correct. Absolutely.
Do you have a backup plan in case the coordinator gets sick?
Do you have a
that might be in this plan. I got everything else in my hand. So.
What if you can't find a coordinator to get sick?
We had Mr. Frank take over. He's just sitting in front of me. He was at Target.
I thought of you, Ken.
Yeah, so did I.
Yeah, he could do it. Yeah. So okay, so that's we'll move along. I know. I just want to. Okay, so when a student, staff member, or visitor becomes sick at school, here's the protocol. And so it's detailed protocol to follow, other tips at the bottom there that we've come up with task force. A lot of this came from the collective work of task force with the superintendent's task force on reopening is where a lot of this came from. So it's pretty thorough. A lot of time was spent on it. I think we've contemplated just about everything. I'm sure we're going to miss some things. It'd probably be a living document. We'd be coming back and updating it. But down the left side, again, considerations for staff, a couple really good links there that is applicable to the slide. Yeah, thank you. Okay, so here's a flow chart. So, going over some of the sort of things that, we need to go over, right? So it just shows a flow chart on how it would go if there's a COVID concern from left to right. And you can see, I think the fourth slide over, it's the first green one, That's our authority, right? So this is the protocol. When we receive a issue or a concern, we go to Kern County Public Health, Matt's group. We call them. They take it from there. It's entirely confidential. They take it from there. Then they tell us what we've got to do. So that's sort of nice in those situations. The professionals take over. And so this slide goes through all that, basically. Okay, so now we're going to Transportation MOT Department. They've got their slide here, transporting students, and you can see the level of detail that we have here for moving students around. Bus stop, and the setup prior to the students get there, when the bus arrives, buses, and again, we worked with Amy McCoy on every step of the way on this. So she's done a lot of work on this. There are different options for loading buses in a COVID environment, if you didn't guess that. There's option 1 and 2, and you can see those down there. She has the one she prefers already delineated in her mind. A couple links there for what bus drivers need to know, and CD Stronger Together, which is the document that has all the protocol generally. That's probably 17. Well, I'm mixing up the document. That's a long document, but it has a section that deals with MOT.
I like the fact that they say they may load them on, first off. I thought that was a good idea.
Yeah, I could limit the potential spread. Sure. Yeah, it's.
The marshal would have to kind of take care of that, but I thought that was a good idea.
Yeah, that bus marshal is another job for someone who likes to challenge the brave.
Yeah.
Cleaning and disinfection, again, MOT department, this is their strike zone. Again, this slide, and again, we worked with Amy McCoy. She's done a tremendous job hitting the ground running with all of this. We procured tens of thousands of dollars worth of what's called PPE equipment already. We're ready for whatever is decided. If there's going to be kids on campuses in a hybrid model with all this protocol, we have purchased and are purchasing lots and lots of protective equipment for staff, students, everybody. And so we've been doing that the last month and a half, anticipating obviously all this. Here's again, daily cleaning. Some of the things that all staff would be interested in here is here. We purchased some fairly expensive new equipment that is approved on what they call the M list to clean classrooms efficiently and quickly, a little bit quicker. It's a spraying system combined with other cleaning techniques. So we've done that. Ryan? Oh, okay, we're finally done. All right, so you want to go back to the other document? Thank you. Okay, so I know that was a lot. I wanted to go through that. Again, you can refer back to that. I did not obviously read the whole thing there, but that is again the hybrid model that's been talked about so much by a number of districts. I think 3-4 weeks ago, as we were looking at this with Lisa and Caleb and everybody else, I probably would have said 3 weeks ago that this model, that's why we spent so much time on it, right? This model was probably the way that I would recommend going, but with the changes and things, it's open to question. I want to review all the new guidance that was released today. That's the reason for tabling the matters, is Mr. Herndon alluded to. There's a lot of new stuff in there, and Matt alluded to. So I want to go through all of it. I really want to take a little bit of time, and I know it's frustrating to table this matter, but the action items got to read right too and reflect the new protocol that was just released 2 hours ago. So we will do that, and we will come back to you. But this is the hybrid plan, and I think that this would stick with the new regulations. From what I heard, they seem similar. It surprised me that they relaxed at least. Okay, they say the CDE or the governor. That doesn't mean the health officials will do this. We've got to go by health protocol, but they relaxed the math requirement. It sounded like to me for K through third. Right?
Yeah.
Mr. Gardner shaking his head, so I think he agrees. So, yeah, so 4 through 8, it would still be there. Now, that's interesting to me. I understand why. It's very hard for the young ones to wear these things. It's hard for me to walk around with it for any length of time. But, I mean, how are they any less of a potential spreader as far as we know, assuming that they are, or the kids are, which is still being left out. How are they any less than an older kid? So that was interesting to me, contained in the room, that they aren't required to do it. Now, I think the CDC and the other two controlling entities, California Department of Health, are gonna probably weigh in maybe differently. They're releasing a document Monday, the California Department of Health, on their new protocol, and that's been happening fairly regularly. So that's just something to sort of keep in mind with that model, I guess. The last structure is the one we'd all love to be back to, of course, the traditional structure, model phase 3, traditional reopening, right? The spread's over, maybe there's a vaccine, you know, whatever the dynamics are, you know, we say, hey, here's model or phase 3. And this would mirror the CDC's phase 1, phase 2, phase 3, basically. So that's why I chose those. Okay, next slide. Operations, transportation, nutrition, hybrid model. It's going to make changes for Ann, right, on the hybrid model, and these are some of those. Food, we still have to feed the children. We're not. So if a student leaves Tuesday, right, on this model, so you have the group A Monday, Tuesday, they leave Tuesday, we are responsible for their meals Wednesday, Thursday, Friday. We're not absolved from serving them. We've got to serve them. So Ann's got to really figure that one out. She thinks she can do that if asked to do so. The Thursday, Friday group, Monday, Tuesday, Wednesday, we're not going to see them again. So we've got 3 service days that we are responsible for, and we want to be responsible for that. We want our children to have that. Under the pure distance learning, just a second to circle back a little bit, under the pure distance learning that we could be mandated to go under here, as Matt was talking about, we still got to do that. We still got to serve, and we're up to the challenge. We did it all summer. We would have, under that model, we're going to have employees that still work for us, aides, instructional aides, noon tutors, and those things that could really help out in those areas, right? So they wouldn't have children here, unfortunately, if we're on full distance learning. So we'd utilize them and anybody else that we needed to. You can see transportation schedules. All buses continue to run. I'm sorry.
Another quick question on that regarding the aides. Is it going to be voluntary, or is it going to be something like, hey, we're going to set up a schedule for so-and-so to come, or what would the protocol be on that if it goes to that?
Yeah, we'd talk to you, Caleb. We'd figure that out with you guys. Yeah. I mean, we would talk to you before we set anything down on that. It's a good question.
Okay.
Not quite that far yet. Monty, I'm sorry. Did you?
No.
Oh, okay. Okay, so you can see, just look at bullet 2 just for a minute, transportation, all buses. We're not going to, Kevin and I drove the district and looked everywhere we bus, and I am not willing to stop our buses. It's a safety issue. We've got kids that we bus from a lot of different areas. Let me give you a particularly tough one. We would have a student who lives, say, down by Chester, on the south side of Roberts Lane down there. Some districts, I've heard, and you know, there's not a lot of approvals by school boards. There's a lot of talk of different models, and they're still going through the process, sort of like we are. But I've heard that some districts are going to drop buses. That is for me, and they may have different situations than we do. That is a major safety issue. I would not be willing to do that. So you see that schedule. All buses continue to run for the safety of our students. On a hybrid model, AB schedule allows for social distancing on budgets to the maximum extent possible. It's still going to be hard, even on an AB, but we feel like we can get there. Masks are required on the buses, but it sounds like maybe not K through 3rd now. So, you know, this is all evolving. It's fluid. Capacity of each bus greatly reduced due to 6-foot separation requirements. Yeah, we can probably put 15 kids on, 15 to 18, 20 kids at the most on an 86 passenger bus and get 6 feet. So we got to be real creative, and Amy's up to the task, Amy McCoy. Bus marshals, again, on the school buses, we would bring that in. We don't have to do that, but we want to do that to make sure if we bring kids back, we're doing everything we can to adhere to all the protocol. Other changes on the buses will be required as per health guidelines, I say there. And then students straight to cafeteria if they're real early arriver, because some of our buses get here at 7:15, socially distanced with monitoring in there. And depending on how late they arrive, they may be straight to a classroom situation. Mental health, we're lucky enough now to have a counselor assigned to the junior high at this point. He's also got a new office, which I think he's going to like in that new office there. So mental health of students and families are a primary concern on reopening. We're going to partner with Kearney County Superintendent of Schools too in that way when we need to for counseling and other services. Our Department of Special Ed, our Director of Special Ed and our psychologist would work on those when needed. Focus on educational equity for all groups. This is critical. If a child in a house in our school district does not have internet connection or a Chromebook to get on the internet, we're going to get them for them. We're going to remedy that situation. So that's an equity digital divide issue, and that's unacceptable, especially for our distance learning. Kevin talked about this earlier. Or an AV hybrid, right? Because 3 of the days are going to be, not with us, unfortunately, on the hybrid. Special ed classrooms to operate on a daily basis on a hybrid model there. There's a lot of different rules with special ed, obviously, and we would adhere to those in this environment. And we would partner again with KCSOS. We do that all the time. Other events, I think I covered this a little bit earlier on the hybrid model, but you can see a sports program, before and after school day programs. I'll talk about that in a minute. Requests for use of facilities by outside groups, that's not going to be happening. Preparation for possible partial or whole school closure, right? We talked about that a little bit earlier. There's going to be protocol from that under the governor's new plan. I just haven't had time to read it yet. Collaboration with bargaining groups. We do that all the time. We're talking all the time to our groups. Assemblies, all those things, unfortunately, some of the things that really, really enrich, and our principals are a great job at delivering, will be out here for a while. Recommendations. So this is before today. I want to throw that caveat in there. We had an action item on there today, which we tabled because we want to give time to think through this and for discussion. But begin the year on a distance learning model, which we may be forced to do anyway at this point, but that's not for sure, right? We'll be optimists and say we're going to go 14 days here on this. And transition to hybrid model as health professionals change restrictions and protocol was the model there. A monitor for transition to hybrid model as soon as public health conditions improve and allow, because the primary consideration is the health and safety, but a huge consideration is getting them back here, obviously, safely. Bring on new distance learning coordinator if approved by the Board of Trustees tonight. We would float that right away. I never floated it, so it's still sitting in Jennifer's office there. Adhere to all protocol propounded by all these groups, right? CDC, California Department of Public Health, and the Kern County Public Health, Matt's organization, who was here earlier today, on any reopenings and that sort of thing, which we talk to him all the time. Run into him half a dozen times on Zooms, a week, probably a lot of people, the 2 people that were here tonight. So that was a lot to go through. That is the hybrid model. A hybrid model protocol is what that is, or was. Okay, so here's where we sit. Mr. Gardner tabled the item, we tabled the item. We will spend, first of all, Kevin and I will spend a lot of time in the coming days working on district guidelines for instruction, signing roles, and all those sorts of things. It'll be 2 pieces probably. One will be sort of a guidebook, and the other will be a lengthier document that deals with curriculum and instruction, schedules, all those things, what's expected. We will then share those at the PDD days on July 27th and 28th that we have set. Mr. Williams has set up. Appreciate him doing that. That'd be a Monday and Tuesday. We envision it on the Monday at 9 o'clock being a Zoom with all the teachers. So that'll be a pretty big Zoom. and going through these documents and vetting them with the people who have to work with them. Of course, vetting with the principals too, also prior to that. And then once we get through that process, we would bring a plan, a detailed plan to the board to deal with a distance learning concrete schedule for teachers. Now, all the superintendents realized that in March, when this was dropped on us in a couple of days and we closed school, that we did the best job we could, but we need to make huge improvements. Okay, let's make no mistake about that. In distance learning and everything we do with it and accountability and the structure. We're going to do that. We're going to put that together. We're going to bring it back to the trustees on July 30th in another board meeting. We'll bring those pieces back and we will bring our final, hopefully at that point, our final recommendation for reopening. We'll know more on whether we are progressing health-wise, of course, in the county, or whether it's going the other direction there. And so we'll learn some more things. It seems late, but a lot of the districts who have put out ideas out in the community on how they're going to start are just that, right? They're out there. They haven't had board action on them. So some are in August, some are in late July. And so I know, the big ones, everybody knows Kern High, of course, right? I went to straight up social distancing. I'm sorry. Social distancing. Getting tired. Went to remote learning 100% to start the first quarter, I think they called out, right? Is that correct? And then Bakersfield City, I believe, did exactly the same thing there. And so there's a lot of big boys, so to speak, that have done that all up and down the state. But, as Grant indicated, we're different than them, right? We're not San Diego Unified. We're not LA Unified. We're not Bakersfield City. We're not Kern High. We're not Sacramento City. We're not San Jose Unified. So I want to take some time to reflect. I want everybody to go ahead and have a voice here next couple of weeks as we put these plans together. And so that's the thought just today after I watched what I saw this afternoon. A little bit of time here. We'll take a couple more weeks. I'll get a letter out to parents explaining it early next week so they know where we are. Okay, because I know there's a lot of questions. I fielded a number of them myself, obviously in my office. But we're trying to do what's best for the kids here, and we need
I have a question.
Paul?
Yeah, Kim or
this is Gina. I have a
What time is
question.
the meeting on the 30th?
oh, I'm sorry.
What time is the meeting on the 30th?
We're going to go back to our normal, if it's okay. Well, is everybody? I know some people have some events. Would it be okay with everybody if we did a little bit earlier again, 4 o'clock on the 30th? Would that work? That would help a few people out.
As long as it doesn't run this late next time.
That's my fault. Sorry.
Yeah,
no,
Way to go, Shirley.
hey, come on, cheap shot. Yeah, no, this has been a long.
It's just, we've been at it for over 2 hours now,
Yeah.
You cut
Paul,
into
I
her
have a
nap time.
question.
It's a lot to absorb.
Go ahead, Gina.
Gina?
I was hoping to hear from the surveys from the parents and the teachers on the 30th. Will we have those results? I want to hear from what the teachers have to say and what the parents have to say.
Absolutely. I've got some of the parent stuff right now. In fact, I was discussing a little bit earlier with Mrs. Anderson. So I'll bring back a comprehensive report on that. We've surveyed Lisa and I surveyed the teachers just on the hybrid models, right? Because that's the way we thought we were going. And so 84%, off the top of my head, 84% of the teachers selected the AABB hybrid model as opposed to ABAB. Okay. So we vetted that through them. We weren't thinking at that time about 100% distance learning. We did not survey them on that. We will circle back and do that. I talked to Lisa about that today. Okay. So that's kind of the teacher side. We want to know what they think, of course, but we weren't contemplating that learning model 2 weeks ago or a week ago or 5 days ago or 4 days ago. So we're looking at that now, and it could be imposed upon us, right? So that's the teacher side. On the parent, the parent side, Gina, 60% roughly, and this is of yesterday, and we still have the survey open. And it's going to stay open the next 2 weeks. What we've seen is a little climb in the a little client, the distance learning responses going that way. I think probably as a result of some of the stuff maybe in the media. I think it's sitting at about 30% of parents saying they would want. Sounds high to me, you know, especially earlier. But some of these have come in more recently. But about 30% calling out 100% distance learning. I believe Kevin can correct me if I'm wrong. And I believe around 60% of the respondents, or a little bit over that, said bring them back to school. Bring them back to school. I can't remember exactly how we phrased the question. So that's kind of where it's sitting. And again, that survey is what, Kevin? Is that a month old?
Yes, it's
Okay.
still open now. It's still open.
Yeah, and it will be. And my parent letter that goes home is going to give them the opportunity to respond to it again. It's going to have the same 3 links or 3 options for responding to it when it goes home early this week. That's a good question. Yeah, we will bring, we'll gather everything. We'll just bring the whole survey back and show it to you.
Is there going to be included somewhere in there the issue of kids that arrive and need to be entered as new students into the schools?
Say that again. I'm sorry, Ken.
In other words, you've got kids that are coming maybe from out of distance, out of town, who knows, but they need to register as a new student in one of the schools.
Yeah.
Are there protocols for that?
Yeah. I mean, the school site secretaries, hopefully they contact the school and we would handle it from there. And we've got Kathy Dinsmore, for example. I was just talking to her the other day. I think they're looking at that site. Kindergartners is a big concern. So she's talking about Mrs. Chamberlain. I don't know if she's still on the call or was ever on the call, but they're finding out a way to do that with them and maintaining safety measures. So anybody who calls in, we would meet with them. They would come in by appointment, probably, to control it, and
sure,
we do it that way. Yeah, that's the thought on it. That is going to be a challenge, though.
Could you keep us updated, perhaps, on what the health department is saying, and if you talked to Matt again?
Oh yeah, I'll see Matt, Terry. I'll see Matt all the time. Yeah, like 2-3 times this week on different Zooms and things. I absolutely will. Yeah, and I will rewatch the governor's release today, this evening, and I will. And again, the California Department of Health is going to release new protocol again, right? So I think that's Monday. So yeah, it's just constant, such a fluid situation. So we will keep you abreast of that, though.
Yeah,
as it
Thank
goes.
you.
We're on Saturday.
What's that?
Will there be any daycare at all?
Yeah. Okay. So Charlene, so here's kind of what we have, and Kevin and I were talking about this today. We've got ACES still; it's fully funded, right? And so we've got those employees. And Kevin, step in. Kevin, why don't you go ahead and handle that one, actually, if you don't mind.
Yeah, we were talking with the Boys and Girls Club, who handles our ACES program, and that they are handling the ACES program for other districts as well. They plan on doing online support for those ACES students. But I also asked not only the Boys and Girls Club, but I was in a Zoom yesterday at the CDE and asked if we have three campuses that are served by ACES. Can we stage all students that want to participate in ACES at one of those campuses, and maybe help out essential workers like teaching staff and people that have both parents out of the home working. So the answer to that was yes. Now we just have to figure out a way to put it in place. So I'm working with the Boys and Girls Club, Chris Molina up there, and we're trying to get that solved.
Okay, thank you.
Good question. Yeah. And again, those Charlene, those groups are going to be well versed in all the protocol and all that. If in fact we end up doing that, and so they understand that, we would have, of course, discussions ourselves with them on that if we elected to go that way.
Okay.
It's important.
If we do all distance learning, would we keep the same protocol and schedule that we had through the summer for our meals for our kids.
Yeah, we've gotta do that. I would think that we would do that. I'd want to talk to Ann Lehrman. She's not here, unfortunately, she's out of the state, but yeah, I would think that we want to reach as many kids as we can. And right, we had all the sites going at one point. We had BE, we had North and South. I would envision doing exactly that. Maximum, we're gonna have, again, if we're on a full distance learning, we're gonna have employees around who don't have their normal roles. So again, I talked to Caleb about that, but I think that that would be, we'll have people to do that. And I think that that's real important. We would continue to do that.
Yeah, well, it worked. It worked really well most of the summer, and from March to what, first part of July, I think, wasn't it?
It was a long run. It was a long
I
run.
know, long run, but it worked. It worked.
It
It
did.
just shows you how much ingenuity all of our teachers and Anne has to be able to accomplish this on such short notice, I think.
Absolutely. And there's a lot of people involved. We had so many, I put a letter out, at one point. We had so many people step up all the way through the district, administrators, classified staff, teachers coming out in these conditions are, this was new too. You got to remember there's, the fear factor, and everybody stepped up huge. Kevin could correct me if I'm wrong. I don't think we ever had a shortage of people stepping up and helping through that whole process, which is quite incredible. Okay, so I want to thank again everybody for coming today. I want to open it up for some. I do.
Yeah, we said 67.
Okay, right. So, but I want to, at this point, we're still in the public hearing. I want to open it up. I know Lisa would like to say some comments, and others. We're taking on the YouTube side, we're taking it via internet, their questions, and we will get those answered. But anybody in this forum, in the Zoom forum, who has questions or wants to make some comments about this, we want to hear them. So Lisa, or any other teachers on the Zoom, you're on. Go ahead. Yeah. Go ahead.
I have a prepared speech, and then I might go off script if I have to. Who knows? Here goes.
Okay. No problem.
Thank you. Thank you for giving me the opportunity to speak this afternoon. I had this afternoon, but Charlene, I guess I should say this evening.
I think you're probably right, Lisa, but it's okay.
Okay. I'd like to take a bit of time to reflect back a few months before we move ahead. Back in early to mid-March, we were hearing rumblings that our normal lives and routines were going to change rather quickly for us at Beardsley and all of the country, right? We had a couple of days to pack up a few things to send home with our students in hopes that they would return after spring break. We all know that that was not in the cards. But since we're Beardsley teachers and staff, we were able to do hard things. We spent many hours trying to connect with our students and their families, even though many of them didn't have consistent devices or resources at home. It certainly wasn't easy, and it certainly wasn't ideal, but we certainly tried hard. We created packets, we've volunteered to serve meals. We did all that we could to continue to support our students and their families. Teachers took advantage of the many online courses offered by the county office and other places in order to get acquainted and learn about the various programs and systems available to strengthen our virtual teaching skills. Just in the last month or so, you, the board, approved our professional development opportunity where teachers are learning all about the Google Suite in order to provide rigorous lessons if by chance we need to go teach virtually in the future. Let me make it very clear. Teachers feel most at home in their classrooms, full of students who are curious, energetic, and simply fun to be around. We know that classrooms full of eager students and enthusiastic teachers is the best place for Beardsley kids. So when we hear from health officials that this pandemic isn't allowing us to get back to normal, we feel very unsettled because our usual way of teaching and starting the year isn't matching up. I've had dozens of teachers reaching out to me over the last few weeks, asking what school is going to look like. After a bit of calming each other down over and over again, we Beardsley teachers and staff will do whatever we need to do in order to provide the very best educational experience for our Beardsley students. That might very well be 100% virtual learning, which we now feel more comfortable with, or a hybrid schedule where we technically will be doing both jobs at school teaching and virtual teaching, and hopefully even moving back to 100% physical school. With the help of the district providing Chromebooks and hotspots to every single student right at the beginning of the school year, we Beardsley teachers can educate and nurture our students with rigorous lessons, making real personal connections regardless of the way it's done. 100% virtually, hybrid, or 100% good old back to school in class. But at this time, I feel that it's extremely important to listen and follow guidelines from the health professionals and leaders regarding what to do about reopening schools. The safety of our Beardsley community is the most important factor. Even with my heart wanting so badly to head back to room 16 at Beardsley Junior High, my head is saying that we need to stay safe and reduce the spread of this horrible virus, which means to stay home while we virtually teach our students until it's safe to meet again in our classrooms. Before I pass the virtual mic over, I'd like to thank Mr. Miller, Mr. Williams, all the admin, the directors, teachers, and staff, and of course you, the board, for putting in countless hours of planning and preparing for what will certainly be one challenging year ahead. It's my intention to make this not a challenge, but as an opportunity for us as a school district to work together as a team, Team Beardsley, to make the year ahead one to be most proud of, while we show our Beardsley kids that we can do hard things. And I know that this is a very, very hard decision, and but I think together we can make the right one. So thank you.
Appreciate that.
Thank you, Lisa.
Do we have somebody else that would like to speak?
Hi, Jolene here. I have a quick question. I actually have lots of questions, but I'll limit it to one. My major question is, what about subs? In a normal school year, we are vastly understaffed in subs, and a lot of us are taking kids from other classes on a weekly basis to cover that. So what is the plan going forward in this situation?
Yeah, so Jolene, that's a great question. Yeah, we are short an awful lot, particularly on certain days, right?
Yes.
So Angel and Karen are working on that. One of the things we've done is anticipating, hey, we might have a few teachers who are going to need to work from home for health reasons or, along those lines. So we've talked to, Jennifer could correct me here, 4 or 5 long-term subs that are willing to step in, to kind of deal with that. The daily shortage is always a challenge. We're going to try to be as proactive as we can. There's been discussions between Kevin and I, again, taking a look at what we're paying subs, because everybody's going to be competing for them in that situation. And going back and doing another survey. I don't think I've done one in a couple of years. We want to be probably a little bit more than competitive on that to try to minimize that. But it is an issue. So it's something we're going to have to plan for too, because it's going to happen, right?
Yes, definitely.
So you know what's going to happen. It happens a lot of times, particularly on Fridays. So yeah, that's a great concern. We're going to think through it, and we all know a lot that drives that's pay. We want to be competitive, and what is it, Jennifer? Has it been a year since we maybe done a survey on that? Last year we did a survey. I think I bumped it up. The shortage remains.
You did bump it up last year.
Yeah, that's my memory. I think it was last year. Getting a little bit older and it fades a little bit there, but yeah, I think it was last year. And then, yeah, so that is a constant problem and concern that we will think through and talk about more in the coming weeks here. But it is a tough problem. It's a tough problem. We'll look at it from all angles and try to minimize it, Jolene.
Okay. I just want to make sure kids aren't getting split up and put into different classes like we're doing right now.
Okay, understood.
Thank you.
Thank you.
I just wanted to bring back the idea. I mean, nothing has been said. I mean, Paul, shared all of the different options and different ideas, but nothing is 100% set as far as a bargaining thing or anything like that. But I would like to go back to the hybrid, and that it is a lot of work. And so we could have those minimum days. The governor did reduce the instructional minutes. So if we did minimum days, that would cover that. And then send the kids home with those meals. Like Charlene was saying, I mean, Ann and the team got it down pat to serve those meals every day. And if we just did that, and because I understand and I want to feed the kids, but we still are
I do
feeding them.
too, but they were grab and go all summer long. I don't know why they can't be grab and go now,
Right. Yeah. And so I would like to see that, just to make, I think it would be easier for everyone, teachers, the kids, cafeteria. So anyway, that's my 2 cents.
So maybe they could grab and go their lunch and take tomorrow's breakfast with them.
Right.
Exactly.
And not eat it at home, not at school.
Right. So then it reduces the need for taking off that mask to eat.
Right.
When we were able to, the team was able to Zoom with Mrs. McCoy. She was saying that the first bus run gets there to school at 7:15. Well, there's a few of us that get there at 7:15, but technically we don't need to be there till 7:45. So, I mean, if I'm there and let 2 of my students in because they're in my cohort, but their buddies are out there, and I know the kid, I mean, I would want to let them in, but I wouldn't be able to because we would cross-contaminate each other. And so I just think sending it home would be a helpful thing all around.
I agree, Lisa.
Thank you.
I agree too.
Good idea.
Thanks for that.
On that also, we could use a lot, what I was thinking too, that was my idea, one of my ideas too, is utilizing some of those classified staff. We have some yard duty, we have classroom aides and things like that. We could still social distance them, helping put those lunches, because I saw this summer and during the school year, I helped with that also. But it takes a lot to get those bags filled, and that would be, you could still social distance and with them helping do that, and social distance with the distribution. And so it would, I think, give Ann the extra help that she would need, and it would be giving them jobs to do during this time.
I think removing the masks for the children to partake of food is a huge liability that we can avoid by changing this protocol to maybe what Lisa and I and Amy just talked about.
Yeah, definitely agree. If I could just add, Ann, I spoke to Ann about this, and because we participate in the free meal program, there has to be, and the students, if they do come to school, they have to be served at least one meal at school. They can take the other one home with them, but they, and those are regulations that might be freed up later, depending on what's happening. It's like,
Well, how did we do it through the summer then?
because they're not attending school, but if they come to school and they spend time at school, then the meal has to be served at school.
Oh.
So I'm just getting this from Ann. I don't know the rule, so I'm just kind of
Could it be if there's an assigned recess time? So they're not going to be able to just have recess all together. But I've seen a couple of other plans from other school districts where an aide would take out, like my class, and they're in this little zone on the grass. If we were then to provide them with a snack, and they're 6 feet apart, would that be a meal?
Yeah, Lisa, yeah, we're getting into, yeah, those are good ideas. I'd want Ann to, of course, weigh in on that. There's all kinds of requirements there. She's not here tonight, but yeah, we appreciate, we'll take down all those ideas and discuss them with her when she gets back.
There's
But
just
she'll be on the,
so
she'll be on the
much to
next,
think
she'll be on the
about.
next call. She'll be on the next call as well. So.
Yeah.
Yeah, I would hope they would relax, like Kevin said, some of these stipulations with all that's going on.
Yeah.
Yeah, I would think they should relax something, you know, that's a benefit.
Yeah, I agree with both of you.
Well, until we know for sure.
Yeah, right.
Guessing at all this stuff.
Yeah, I wouldn't want to, of course, commit to anything here without talking to Ann yeah, but these are great ideas and we will vet them. We'll vet them through Ann and others. Lisa, appreciate that. Did anybody else that would like to, Lisa, do you have more comments or?
I'm fine. I'm
Okay.
finished. Thank you.
Okay, thank you. Anybody else at this point? Okay, Caleb, did you want to say anything for CSCA or do you don't have to? Don't have to.
I mean, once we get to a decision, I mean, that's probably the best going forward with what we have in mind for CSCA. So whenever there's a decision, I think there's questions on both ends. If we go hybrid or we go distance learning, there's several questions, but we'll get to that whenever we make a decision.
You bet. Thank you. Okay. And Caleb and I have been in contact the last couple of weeks too. So it's okay.
I would just like to say and thank everybody for how hard they work, for the team that we have at Beardsley, how everybody tries to do what's best for the students. You know, I just think we've got to do all that we can to make sure that they get the best education they can. Grateful that everybody's, working to step it up because I know it's going to be hard. I know I would love to see them be back in school just like everyone else. And we have different levels of how we're going to do that. And I know that the state is tying our hands in many ways and it's frustrating to me, but I understand how it all is going to, we may not even have a decision to make. So we're going to have to wait and see. It may be mandated, but I appreciate everybody and how they work. And the students are number one.
Well said, Terry. I agree.
Absolutely, Terry.
You bet. You bet. And again, if anybody else, feel free to speak up if you'd like to. Okay, I think seeing none, I think, Monty, if that's the case. And again, we have questions, I believe, coming in from the YouTube, which we will get to. If I don't have the answer, I'll find it.
Yeah, I responded that we will take and screenshot them all, share them with our board members and have answers for the next one.
I think that's really good. Great.
Thank you.
Okay, Monty, I think we could go back out of public hearing.
Yeah, we're now out of public hearing. I need a motion to table number 5, A and B until July 30th at the next board meeting.
So moved.
Second.
We already did that.
No, we did not.
Okay, we're good with that one.
Terry,
Aye.
Charlene,
Aye.
Ken,
Aye.
Gina,
Aye.
and I vote aye. Okay, we will table number 5, A and B until the July 30th board meeting. At that time, hopefully we'll have some answers. Number 6, consideration to approve a new job description, distance learning coordinator, and we have an exhibit.
So moved.
Second.
Mr. Williams, you mind talking about that position a little bit?
Yeah, with all the new possibilities with distance learning, whether it's 100% distance learning or a hybrid, there's a definite need for this. Might, like some of you indicated, it might be a bigger need than one person can do, and we actually have some plans for that as well if that happens. But we need a coordinator, someone that can go between the families and the teacher to make sure the families have enough, have the equipment needed so their students can perform distance learning, whether it's the internet connectivity or the device that uses the internet to do that. So that'll be a big portion or a big part of this this job description, but as well as helping teachers that might not, even though they've taken this Google Suite level 1 educator lessons, and they'll participate in our professional development on August 27th. There's still going to be people that don't feel extremely comfortable moving to a distance learning situation, and we want to make sure that that's improved over March, and that'll be this person's job to kind of coordinate that and help those people out.
Sounds like they'll be working hand in hand with that community specialist too, right?
Yeah.
Along with teachers and, yeah.
Good. Any other questions?
Do you have any idea if anybody's interested?
We go ahead.
Didn't hear the question, but I think you asked if we have any interests in the position. This position hasn't been flown yet, so I don't think anyone knows about it.
Okay.
I had a question about the position, the one that, let me see if I can find it. When they work with parents, essential functions of the position, work with parents and other stakeholders to ensure learning readiness. Am I reading into that they would go to the student's home to set up a computer if needed? Do they know they have to do this?
At this point, nobody knows anything because we haven't flown the position. We would make it clear what their responsibilities are, and if we're in the same stage that Matt Constantine says we're going to be in the coming weeks, then we would have to do that remotely. You know, someone can work. It's just like when we passed out computers in March, the principal set up stations and they wore masks and they kept their distance. So you can still do things like that. We could have a training center set up where, you know, it's hard to see a computer screen and share that if you're standing 6 feet apart. But if you're in like the boardroom where Mr. Gardner and Mr. Miller are right now, you could actually stay 6 feet apart, project the computer up onto the smart board, and everyone sees that. So there might be a little bit of training involved. And of course, we'd keep social distancing in place, and we'll work through that.
Okay, thank you.
Any other questions? All right, Terry,
Aye.
Charlene,
Aye.
Ken,
Aye.
Gina,
Aye.
and I vote aye. Number 6 passes. Number 7, consideration to approve a contract with Maxim Inc. for health-related personnel and services.
So moved.
Second.
So I'll go ahead and take this one. This would be on an elective basis by the district only. It's a contract for hourly services for RNs and LVNs and those sorts of things, where I would envision needing this to help with all the different things we're required to do on all the protocols and dealing with, hopefully it doesn't occur, but dealing with COVID situations at school. We have one nurse right now. And we've got one LVN at North. We would contract most likely for LVN and or nurses to help out with that. That would be certified to handle things that may come up here. So that's the reason for that. If we come back on a hybrid or full traditional model, but we still have protocol to follow and we're still in the aftermath of this, that's where this would come in.
I think it's a good idea myself.
I think you need it.
I agree.
Okay, good.
All right. Terry,
Aye.
Charlene,
Aye.
Ken,
Aye.
Gina,
Yeah, aye.
and I vote aye. Number 7 passes. Okay, certificated and classified personnel comments.
Lisa's shaking her head no.
Okay, board comments and informal discussion. Okay, I'd like to thank everybody for tonight. I know that it's been a super long meeting, but I think it was necessary. I think Paul did a great job putting this all
Great.
together. And with that being said, if there's no more comments, we will plan on our next board meeting being held July 30th at 4
o'clock.
At 4 o'clock. If that changes, Paul will be in contact with all of us. And at that point, it is 6:41. We are now adjourned.
Good night, everybody. Have a good
Thank
evening.
you.
Thanks to everyone.
Thank you.
Bye.
Bye-bye now.
Night.
Good night.
Have fun, Gina.
Yes, it's 10 o'clock here.
I know. I was gonna say.
That's why, yeah.
Thanks for calling in from back at.
Good night, everybody.
Orlando. Orlando.
Good night.
Go home and see my great grandbaby. He was born today.
What?
Chris had a son today.
Oh, man, congratulations.
I am a great grandpa.
Did Chris? Wow, awesome.
Yep. And he's still, he'll be here in January.
Nice. I got to see him. Yeah.
Yeah.
It's been a long time.
Yeah, he had it. I saw a real quick picture of him, so I told him I'd go home and see some more this evening.
Yeah.
Thank you.
Congratulations.
Awesome.
Yeah, I'm gonna get some sleep.
And then, yeah, try to. If you need me here on the 30th, just let me know.
Absolutely. Okay, thank you.
Not a
Lonnie.
problem.
Thank you.
Kevin. Oh, darn.
See you soon.
That back door is. If you guys aren't a gatekeeper for that building, there's one door in there.
Thank you. Have fun this evening. Thanks, all right.
Okay, thanks.
Thank you.